is such a conclave where it's one of a kind conclave where all the physiotherapy, fitness, sports dentistry, they're all coming together. And today we are going to start with a new journey, because I would like to say that coming together is just the beginning, but working together is success. So I would like to hand over the mic to Dr. Sneha Divekar now.
Good morning, one and all. So आपण जसं दीप प्रज्वलन करतो, सो हा युनिक कॉन्सेप्ट आहे जरा. सो आम्ही हा जरा शोधून काढला, कारण प्रत्येक वेळेला छोट्या छोट्या कार्यक्रमांना ते दिवा वाट वगैरे सगळं नेणं पॉसिबल नाही होणार. सो सन हॅज गिफ्टेड अस दिस, बिकॉज हे आम्ही बाहेर ठेवलं होतं उन्हात आणि त्याच्या ह्याच्याने झालेलं आहे. सो आपल्या कार्यक्रमाची सुरुवात आपण ह्याच्याने जेवढा वेळ त्याला बॅटरी सनची मिळालेली आहे तेवढा वेळ ते राहील. सो येस, सो आय जस्ट इन शॉर्ट आजचा फ्लो सांगते. सो आता आय एम टू टॉक अ लिटल बिट अबाउट व्हॉट इज स्पोर्ट्स डेंटिस्ट्री आणि काही एक पॉईंट्स की हाऊ स्पोर्ट्स सायन्स आणि स्पोर्ट्स डेंटिस्ट्रीचं कसं कनेक्शन आहे किंवा कुठल्या टॉपिक्ससाठी कोऑर्डिनेशन लागतं. मग त्याच्यानंतर NSTCचा एक व्हिडिओ वी विल प्ले आणि आमचे जे एक ऑनररी मेंबर आहेत डॉक्टर जयेश रहाळकर, सो ही विल बी कमिंग सून. सो ते आले की गेस्टचं आपण इंट्रोडक्शन आणि फेलिसिटेशन करू आणि आमचं NSDCचं ब्रोशर आमचं रेडी केलेलं आहे. सो ब्रोशर रिलीज आपण करू, कारण सरांना थोडंसं 9 वाजेपर्यंत त्यांना मुंबईला जायचं आहे. सो 9:15 पर्यंत ते आपण संपूयात. त्याच्यानंतर जे ऑडियन्स आहे त्यांचं थोडंसं प्रत्येकजण आपलं 1 मिनिट इंट्रोडक्शन कसं असतं त्या पद्धतीने ऑडियन्स स्वतःचे, बिकॉज वी वॉन्ट टू नो व्हॉट एव्हरीवन इज डुईंग, सो दॅट वी विल डू. आणि ॲट 9:30 to 10 विल बी द ब्रेकफास्ट. 10 to 10:30 जे स्पीकर्स आहेत त्यांचं प्रत्येकाचं 10 minutes स्पीच असेल आणि 10:30 to 11 विल बी पॅनल डिस्कशन आणि 11 to 11:30 थोडं नेटवर्किंग, फोटोज असं सगळं असेल. सो आय थिंक इट्स 8:15 या येस. सो आय थिंक वी विल स्टार्ट ऑफ. ओके, वेलकम एव्हरीवन. आय एम डॉक्टर स्नेहा दिवेकर, founder and director of National Sports Dentistry. So good morning everyone. So I'll start with the topic. So today we are, I'm the founder and director of National Sports Dentistry Committee, and I'm really happy and proud that we could present a very different concept today, sports dentistry and sports science conclave. So let me begin. So some of you might have heard about sports dentistry, some of you might have not. So the question that arises here is that is it an old field of dentistry? Yes. In UK, Australia, US, it has been there around since last 3 decades. But is it new in India? Well, yeah. So everyone knows that all contact sports people, those who are having mouth guards which are mandatory. So yes, they have been using, have been going to the dentist to get mouth guards done. But officially as a separate branch of sports medicine, no, we have not been referring it to as a separate branch. So now it is important. It is new in India, yes. So it is important to increase awareness regarding it. So our plan of action is to educate the dentist, to educate the athlete patient, and to educate the sports administration and all sports science people like present here. So what are we going to discuss today? Prevalence of dentofacial injuries and their impact, introduction to sports dentistry, components of sports dentistry, or to be specific, what is the role of the sports dentist, overview of mouth guards, coordination of dentists with the sports medicine of the sports science team, and in the end, how does oral health affect performance? So why is it important? 50% of kids participating in sports could experience a dental injury by graduation. Then there are a lot of teeth, 3 million, 4 million, 5 million. These are the kind of statistics that have been made in various surveys taken, especially in countries like US and UK. Welcome, sir. Please. Please come and sit in. Most common type of oral and facial injury sustained during participation in sports, and the most important part here is that the majority of these injuries are preventable with the use of mouth guards. Yeah, so 5 million teeth are damaged or lost each year in sports. An athlete has a 33% chance of sustaining a dental injury in sports. 80% of the tooth injuries, as we all know, are mostly to the maxillary central incisors or the two front teeth. Now, where are the dental injuries most common? They are most commonly seen in contact sports. Now, what do we mean by contact sports? These are those sports in which the players physically interact with each other, trying to prevent the opposing team or person from winning. Now, the rate of injury can be from 2% to 33%. This is the range that has been seen by the dentists who have been doing surveys regarding dental injuries in sports, not just in India, but across the world. So, which are the sports which will require mouth guards? So, top, again, we have customized a little as per what is happening in India. So, the top sports, Indian sports where mouth guards are a must is football, hockey, cricket, boxing, kabaddi, soccer, cycling, gymnastics, basketball, mixed martial arts, volleyball, and skating and cycling also. Believe me, because what I have seen is that a lot of kids, especially in their younger years, most of the injuries that we have seen are from cycling and skating because they are falling on their face all the time. So, we as dentists, we know, and you also as sports science specialists, physiotherapists especially, you know what the physical impact is. But most important, we are especially dentists, we are so engrossed in treating the physical aspect of it that we don't realize what the psychosocial impact of these injuries, especially because the athlete is a public figure. So for them, their face has a lot of value. So especially if it is a major injury, facial injury is also involved. It can lead to depression, anxiety, hostility, loss of self-confidence and image, and reduced self-esteem. And sometimes what happens is these symptoms may not be, the athlete may not be into full-blown depression. They will be what is called sub-threshold. They may not meet the diagnostic criteria of a full-blown depression, and that is why there will be poor intervention and poor rehabilitation. So we have to take care of the psychological aspect of the athlete also in this case. This is a very, very important part. This is where we want to help from you to convince the athletes to use mouth guards, because the economic considerations is a lot of expense involved. The recovery process is lengthy, multiple surgeries are required, thousands to lakhs of rupees depending on what kind of injury has happened to the face, and the surgical treatment keeps on going because sometimes the plastic surgeons also need to be involved. Okay, so the social stigma is there, less acceptance is there. So we have to emphasize to the athletes that protective equipment is definitely cheaper than any kind of rehabilitation. So, am I the only one who is saying all this? No. All over the world, various world dental associations are recommending mouth guards. So, the American Dental Association has been recommending mouth guards as early as 1940s, and currently ADA recommends mouth guards literally in 29 sports. You can see the huge list. The Australian Dental Association has identified 20 sports played by Aussie kids in which mouth guards should be worn. So they are having this kind of tagline, game on. When it's game on, it's mouth guard in. So we have to motivate athletes to use mouth guards like this. So sports in India are on a rapid rise in the 21st century. Our athletes, from the dental point of view, they need two things: dental care and trauma prevention to give them a competitive edge. So what we need to do together is, dental groups and associations in India along with sports bodies at various levels, we need to include sports dental care or sports dentistry. Now this is going to help not just to improve the oral health, but to improve the overall health of the athlete also. How we will come to know. So there is Dr. Rob Price, who is head of medicine and performance at Leeds United. Now what he has to say is, there is nothing more annoying than a player missing a game for a problem that was preventable or could have been treated earlier. This is exactly why sports dental care is important, because sports dentistry is 80% preventive dental treatment involved. So what is sports dentistry? Technical, the definition is, it is the branch of dentistry dealing with prevention and treatment of the pathologies and injuries of the oral cavity and the stomatognathing system related to sports activities. So we will just in short tell you about what are the main components and the additional components. By that we mean the main role and the additional roles that a sports dentist needs to perform. So of course, first most important role is the oral care of the athlete, mouthguard fabrication. So dental checkups, taking the history of the athlete and risk assessment for trauma. So whenever there is a pre-season examination, that is the best time to do this. And at that point, a risk assessment of our injury has to be done. At that time, what the dentist will do at that time. Explain the type of mouth guards and their importance. Recommend a mouth guard according to the athlete's age, dental issue and the sport played, and fabricate the mouth guard and give instructions for care. So these are like, the sports with very high risk for mouth injury. So that is why the dentist will need to take the detailed history, sports history, playing history, nutrition history, psychological history. So usually every subject has its own case history form. So we have devised a special case history form for sports dentistry also. Like sir, how we have separate for ortho, pedo, same way there is now a separate form for sports dentistry also. Yeah, so very important, again, nutrition assessment and counseling, why this is important. So there is a high carb diet, obviously is needed for optimum performance, but then it has to be a little bit carefully chosen, because there is a lot of side effects, there is a lot of risk for dental decay or erosion. That is why it is imperative that the dentist understands the dietary habits along with the oral hygiene habits. Both these two things are eating habits and oral hygiene habits, they are extremely linked together. So the dentist has to instruct the athlete regarding the usage of certain foods which are commonly seen in sports setup, like sports drinks, carbonated beverages, and encourage use of chewing gums, eating more complex carbs rather than simple carbs. The type of texture of food that the athlete patient has, that it is going to have a lot of effect. I'm sure the pediatric dentists, they know what happens when they see young patients. Very, very important is prevention and injury management. Now, in emergency situations, see, the dentist is not going to be there. Some of you are going to be there on the field. So it is our duty that we will train you for, how to do the emergency dental trauma management. So now the coach, team, physician, dentist, they have to be competent in initial assessment and management techniques with the help of first aid. Of course, any dental and facial injury involved, first we have to see whether body parameters are normal. If the body parameters are normal, only then we can shift for the dentofacial injury evaluation. And all the dentists sitting here, they know that injury management, dental injury management is a big multidisciplinary task. So thorough and specific evaluation of the oral injuries has to be done once the emergency aspect is taken care of. Long-term management includes many specialties of dentistry like oral surgery, endodontics, operative dentistry, orthodontics, hospital dentistry, and patient behavior management. So what is the role? See, I am a BDS, I may not be able to do each and everything, but my role as a team dentist, I am responsible for the dental care of my team. So my role is to coordinate with the, not just the dental specialists, but the medical and the sports science specialists sitting here. So this was all the main role. Now we will talk about the additional roles of the sports dentist. So referral to the proper medical personnel. So sometimes what can happen is the dental injury is visible, but the concussion is not visible. So the patient is rushed to the dentist because there is a severe dental injury. But if the dentist knows that these are the symptoms that he or she has to see, only then they will see for it. So symptoms for detect early symptoms of mild brain injury, like headache or feeling of pressure in the head. If the athlete appears dazed or stunned, if the athlete can't recall events, so the dentist will come to know when he or she are taking the dental injury history. So that is what they need to know. If there is any nausea, vomiting, so any of these symptoms, immediately the dentist has to refer the patient to either the sports physician or the neurophysician who is involved. And for any other injuries also, the patient has to immediately refer. So we cannot delay that at that time. So yeah, so cerebral concussion, head and neck injuries. So these injuries, there are very high chance that they can be together with the dental injuries. Next is recognition of doping. So doping, you all guys know that it is use of performance enhancing drugs and PEDs. So obviously sports organizations all over the world have banned them. So the dentist needs to be familiar with all the drugs and try and recognize any symptoms of doping in the athletes. So we will talk about that a little later during the panel discussion also. Recognition of tobacco, substance, drug abuse. See, now very simply I will tell you that the patient is not going to go to the sports psychologist or the nutritionist telling that I am having this habit. What the patient will do is go to the dentist saying that I have a lot of stains in my teeth, or I have a lot of sensitivity in my teeth. So that is the perfect time. So there is a very high chance the dentist can be the first person to diagnose that something is wrong, or either they are having some habit, or there is an eating disorder, or some kuch to gadbad hai. So smokeless tobacco can also be addressed under sports dentistry. The dentist can identify athletes with substance abuse or drug abuse. Health assessment. Now look into the matters of the overall health of the athlete. Research has proven that poor dental care affects the overall health. So we as dentists, our role is to make sure that because of the dental problems, there are no any other health problems. Of course, and we all know that there are not just Olympic normal regular athletes, there are para athletes, there are special Olympic athletes, so many are there. So as a sports dentist, it is our duty to cater to a wide range of people. So now problem what happens in these especially young kids is that because of these problems, their oral problems are even worse than the normal people. So behavioral issues, developmental disorders, cognitive disorders and systemic diseases, all these increase a child's risk for oral problems. And the athlete, when the athlete becomes ages, the problems even worse become more worse. And recognition of eating disorders. Now it is not very uncommon for dentists to recognize the symptoms of anorexia and bulimia through dental examination. So man, you know that women's gymnastics, volleyball, basketball, these are just few sports where eating disorders are common. So erosion patterns, how there is a technique how you can identify because of what reason the erosion pattern is there. So the erosion patterns in the teeth caused by gastric acids often help the dentist in the differential diagnosis, so that we can make out why this is happening. Okay. So of course very interesting, everyone wants to know, wherever I go, first question everyone is asking me, what is a mouth guard, what are the types of mouth guards? So a mouth guard is basically a protective device for the mouth that covers the teeth and gums to prevent and reduce injury to the teeth, arches, lips. The mouth guard is most often used to prevent injury in contact sports. Also there are other ways also for mouth guard or night guard is used, like treatment for bruxism, TMD, or as part of dental procedures like teeth bleaching or sleep apnea. Now talking specifically about sports, they are mainly of three types. Over the counter is what we see most of the athletes are using, but they are absolutely not recommended by the dentist. Then boil and white. So boil and white again are very common, and yes, boil and white there are good quality boil and white mouth guards, which yes, we will still recommend that athletes can use. They are boiled in water and formed to the teeth. Customized mouth guards are the ones that the dentist will recommend, obviously, because they are customized, and that is why they give proper protection. Only because it is customized, it is going to protect the teeth better. So how do they protect? So what is the impact of injury? Under chin impact, it causes damage to the teeth, TMJ and jaws. Direct impact also same problem. Mouth impact can cause possible damage to the soft tissues of the lips, cheeks, tongue and gums, as well as the teeth and upper jaw. So what will happen if we use a properly fitted mouth guard? So the Academy of Sports Dentistry in the US, they have devised this term properly fitted, because mouth guard, it is being bombarded by everyone. I am giving mouth guard, best mouth guard. But is it a properly fitted mouth guard? They have come up with a category. What do you mean by exactly, what is the properties of a properly fitted mouth guard? Because only that will actually prevent injuries. नहीं तो कोई भी आएगा और बोलेगा कि मैं माउथ गार्ड दे रहा हूँ, it doesn't happen like that. So jaw fractures, TMJ trauma, lacerations to the lips and gums, especially for ortho patients. Yeah, you can imagine, you must have experienced also that when the child is, because what happens is a lot of young children, they are playing sports also, and they are having undergoing orthodontic treatment also. So that can become even worse if they get any kind of trauma. So a quick comparison of all the three types of mouth guards. Stock mouth guards, as I said earlier, no individual fitting is desirable. It is available in sports stores, but we absolutely don't recommend it, so we don't talk about it also. The only two mouth guards that we focus on are and we give to our patients are boil and bite and custom made. Boil and bite, the individual fitting is attempted by boiling the material and adapting to the material to the individual teeth, but it is again less desirable because there is uneven distribution of the material. But again, having said that, there are a lot many mouth guards which are coming up in the market which are really good boil and bite mouth guard. So it is up to us, because हर नए दिन हर नया mouth guard आ रहा है, so we really up difficult task. We have to keep updated, remain updated, because the patients know more than us about the mouth guards. Custom fabricated, the most preferred type of mouth guard is this, because it is fabricated under the proper guidance of a dentist. They are either made in the dental clinic or sent to by the dentist to the dental lab for custom fabrication. Now this is the advantages, this is the most important part for you also to convince the patient, because the most important problem that the patients come up with, we can't talk, we cannot bite properly, we cannot speak properly, we cannot breathe properly wearing the mouth guard. That is why they are not using it. But this is the biggest advantage. They can do all that wearing this. But most important, तुम एक दिन इवेंट के पहले अगर तुम यूज करोगे, it is not going to help you. They have to start using it during the practice session. It is just like a denture. जैसे हम लोगों को denture देते हैं, we tell people you need to get used to it. So they need to get used to it. Once they are comfortable, then they can play on the field well and perform well. Yeah, most important and interesting part we have come. So interaction of sports dentist with the sports medicine team for various dental issues. So these are all the players on the sports medicine team. We'll just quickly go through each one. So with the sports medicine physician, the dentist has to coordinate for various health issues of the athlete, especially related to sleep, because there is a huge topic called dental sleep medicine coming up. So if I start talking, then it will take the whole day. So I'm not going to delve into any details of anything. Cardiovascular problems, diabetes, body deficiencies, performance and injuries, for all these things, the dentist needs to discuss with the sports medicine physician. Then, of course, the coach, because it is important for the dentist to be in touch with coaches and physicians to resolve dental issues of the athletes and stress on preventive dental treatment. Sports nutritionist, the dentist has to discuss cases of severe dental caries and dental erosion and guidance on sports drills, because together we can guide the athlete patient better. Sports psychologist, dentist has to discuss in cases of bruxism, severe stress, eating disorders and dental erosion. Of course, even in cases of suspected drug abuse, tobacco abuse and PTSD for dental-facial injuries. I'm sure you will be interested to know about that. Sports physiotherapist, yeah. So athletes are, we must have seen mouth breathing. They are doing. So it is causing a lot of erosion, a lot of problems. So we will talk about that in the panel discussion more. So the dentist needs to discuss cases of buccal respiration, history of frequent falls and recurrent Achilles tendinosis. So all these problems are happening in the athlete patient because of probably gum infections and stuff like that. Then, of course, other healthcare professionals, because in younger patients, we need to be in contact with the pediatricians for fitness evaluation, treatment of trauma injuries, and especially for special care athletes. Because, for epileptic, asthma, diabetic young athletes, the dentist needs to discuss cases of dental trauma in young athletes, motivation for mouth guard use, and any other suspected illness. So this is just a short summary of the whole thing. So, I will come to the last part.
Podiatrist.
Podiatrist, yeah, for occlusion, posture, see, here in our country, we will refer to the physiotherapist or the orthopedic surgeon for that. Yeah. This is just a summary of what I just told earlier. So basically, the role of the sports dentist is mainly in two ways: in the clinic, on the field. Both the things the dentist in the clinic we need to treat, and similarly, mouth guard programs on the field, pre-season dental screenings on the field, all these things, delivery team dental care on the field also needs to be done. So the dentist has to do a bit of both. And as I said earlier, pre-season dental examination, medical history, dental history, x-rays, comprehensive dental examination, soft tissue examination and mouth guard evaluation, very, very important. If they are not wearing a mouth guard, then that is the time to give them. If they are already having one, the examination of the current mouth guard is needed. The dentist will look for broken, missing or decayed teeth, gingivitis or gum conditions, erosion patterns, soft tissue anomalies. Impacted third molars is very common issue in the age group of 18 to 30 years. And that is the peak time for any athlete, as you all know. So these are the things, this is the perfect time for the dentist to tell the athlete patient about the things that I told you earlier, like oral health, pitfalls of sports drinks, wearing a mouth guard, health hazards for smoking, and most important, teaching them the correct oral hygiene technique. This is very important. So see, currently there are a lot of dentists ask me what is the job opportunity. There is no direct job opportunity like how the sports nutritionist or the physiotherapist. There are job opportunities for in various sectors like Sports Authority of India. But right now what we are focusing on is to work as a consultant sports dentist or a team dentist for various sports clubs, academies, schools, colleges, and just like other sports science professionals, the dentist is also needed at local level, district, state, national and international level. So to conclude in the end, just to sum it up, how exactly does the athlete's performance get affected by oral health? Most important is dental pain. Because we all have experienced dental pain at some point in our lives and we now know how horrible it can get. So how is it interfering in the athlete's life? Diet alteration, improper nutrition, sleep disturbances, self-medication, inability to train hard and loss of confidence, and most important, we all dentists know that the dental pain is not going to go away on its own. The treatment has to be done. Preventive dental treatment has to be done. So as I said earlier, gum diseases have been associated with heart disease, cerebrovascular diseases, respiratory problems, preterm births. If there is injured Achilles tendinosus, yeah, so this was another thing that if there is if the problem is recurring, then we need to ask for if there is any chronic gum infection. Okay. Yes, because the immune complex of the body is connected. So if there is a chronic infection, any injury as for that matter, this is one common problem which has been seen. But if there is injury in the body, if it is not healing, gum periodontitis can lead to that problem. It is not helping the body heal, it is making the body worse. Gum problems, because a lot of bacteria toxins are getting released through the gum infection in the entire body and it is not letting the body heal.
Allow me this is a rotator cuff.
Pardon?
Rotator cuff.
Rotator cuff. So that's what I said, that any injury in the body, if it is not healing, then there is a high chance that the gum infections can be responsible for not letting it heal in the time, in spite of everything. And this is very, very important and interesting, and a lot of studies are coming up for this, that the way the patient bites, dental occlusion, it is affecting the entire body. TMJ and the bite is affecting the entire body. So this is a computerized image. It is revealing that 85% cases reveal that bad bite is leading to unequal force distribution in the athlete's feet. So there is a huge neuromuscular dentistries also we are involving. We have now on our honorary member, one neuromuscular dentist also we are involved just for that. So wearing corrective dental tray or mouth guards will improve symmetry of the running pattern and reduce chances of injury. And we all know dentists, especially orthodontist and pediatric dentists, that the face is responsible or how the structure is, how the teeth are. It is face types. Studies have revealed that flat, long facial types, incompetent lips, all these can cause fatigue, insomnia, cold, allergies. So obviously all this is definitely going to affect the athlete performance. Now this is again a very big topic. I know a lot about it. I can, there is a time constraint, so we have to just cut short and reach to the end of this topic. So these are just few images that how dental treatments need to be done to motivate. This is like a mouth guard care kit. These are the types of mouth guards. I think we have brought them, we will show you later. So these are just few cases. This is a custom fabricated mouth guard. These are boil and bite mouth guards that are available in the market. So few years back, I met a female national hockey player. She shared her story. Some days before a national event, she had a tooth problem which she ignored. One day before the final match, the tooth developed severe pain and swelling. She took medicines, but we all know that, especially if there is a swelling, the pain is not going to subside. So it did not completely stop, and her performance got affected that day. So she told me, I repent a lot doing that. I wish I could have recorded what she said, but that time it didn't strike me. So the only solution is preventive dental screening and timely dental treatment. Mouth is the mirror of the body. An athlete with a healthy mouth can eat a wide variety of food without discomfort, communicate well with peers, concentrate well on the field, and can practice the sport of his or her choice without disruption. So, thus, any dentist interested in becoming a sports dentist must need to know all these things, that the presence of dentist in the athlete support or healthcare staff is of paramount importance, and that is why we have made this gathering, because the topic of sports dental care needs large-scale awareness so that the dentists, athletes and the sports healthcare professionals realize the importance of neglected oral health of athlete, or there is something is missing in the entire link of healthcare spectrum for the athlete. We are everyone is running towards 2036. There is a lot of explosion everywhere about sports science, sports medicine, so many conferences, programs. So where is oral health standing? That is where we come in. So sports dentistry is nothing but one step towards the future, an important part of the sports medicine team. Thank you so much for patiently listening. Whatever we have done, whatever our aims is, who are current members and everything is. So I think we will now, it's already 8:50, we will proceed to the next part. So now we will be introducing our guests, and our sir will be felicitating them. So I think we will just slightly change the arrangement. And we will also have inauguration of our NSDC brochure that we have designed. So yes.
I would first like to welcome Dr. Jayesh Raharkar sir. Who doesn't know him? He's a very renowned member of dental community. He has done masters in the subject of orthodontics in addition to DNB Ortho and DIBO. He is also a consultant orthodontist at Dinanath Mangeshkar Hospital, Pune. He is a visiting professor, Department of Orthodontics, D.Y. Patil College, Hospital, Pune. Former HOD, D.Y. Patil College and Hospital, Pune. Past president and EC member of Indian Orthodontic Society. Past chairman and director of Indian Board of Orthodontics. Founder, convener of Pune Orthodontic Study Group. And also I would like to mention that he has his own clinic on Tirak Road, and he is very approachable and very friendly also. Thank you sir, and we welcome you.
Last name was most important.
I would like to ask our director, Dr. Sneha Madam, to felicitate sir with a token of our appreciation. We often do not know what people do in various different fields, and I am very fortunate to know all you members on the dais, and your work is incredible. I mean, I did a background check on you, and it was incredible, incredible, absolutely incredible. I would like to start with Gaurav sir. Gaurav Rajan is a strength and conditioning coach, and he plays a holistic role in athletes' well-being. He has a wealth of experience in managing top athletes. He fashioned the fitness and well-being of renowned athletic names like Ankita Raina, WTA player at 148, Olympic level wrestlers like Bajrang Punia, Amit Dalia and Rita Fogart. He is founder of Nijon Training System, and he has an interest in simplifying sports science literature and applications. I'm sure this is a very brief introduction. May I request Dr. Jayesh Raharkar sir to felicitate sir.
I request the director of National
Thank you, sir. Thank you, ma'am. Introduce Dr. Richa Kulkarni, ma'am. She's also very interesting. She has done a bachelor's in physiotherapy from PES Modern College of Physiotherapy, Pune. She is an experienced physiotherapist with demonstrated history in working in health, wellness and fitness industry. She is skilled in sports rehabilitation, manual therapy, treating of musculoskeletal conditions and more. She has worked with the women's national team Thailand at AFC Women Asian Cup India in 2022. She is the owner of Kinesis Sports Rehabilitation Physiotherapy Clinic, Pune. So very interesting profile, ma'am. We are very glad to welcome you today. We are Thank you, ma'am. Anjali Bhide, ma'am. She also has a very profound and interesting search on the Wikipedia. So, and I found her very quickly, which says a lot. So, Dr. Geetanjali is a nutritionist, academician, researcher, author, and speaker. Her vision is enrich food and ensure fitness, and is quite applicable to the well-being of athletes. She has worked in reputed colleges in Pune and Mumbai and teaches courses in food science, human nutrition and sports nutrition. She has done a PhD in food nutrition dietetics from Mumbai University, MSc in food science and nutrition from Sri Satya Sai University, has won Young Scientist Award for Experimental Nutrition, Nutrition Society of India in 2004, J.N. Bose Memorial Award for Community Nutrition in Indian Dietetics Association. Thank you, ma'am.
So our honorary member of NSDC.
Take.
Okay, we will just. Perfect. Everything is going on time. So 9:30 we have breakfast. So before that, now what we would like is to know more about the audience who is sitting. So roughly what we want is a 1-minute introduction. Each one should give what field they are, what they are doing, like that. So I think we'll just start from here.
I'm Dr. Deeplakshmi Peshwe. I have 27 years of experience. I've been a dentist before for 9 years. After that, I moved in the field of counseling. So 16 years I've been in the field of counseling. I'm also a black belt in karate, and I'm so honored to have my sensei here, Sensei Arnold Lobo. I've just finished my black belt at 51 years of age, and we've been together, sir, one more Sensei Ganesh Kamble. So I think I have the unique distinction of being in all the fields, and let me tell you that I've been using mouth guard because now I'm into fights as well. Earlier I was just into katas and all that. I'm now a competition athlete, karate, and I'm so glad that I could give her the opportunity and we could coordinate and have the dental camp in my competition. I was there we just had it recently on the 2 weeks बालेवाडीला competition होती आणि मी माउथगार्ड घालूनच फाइट करते. So I can vouch, so I'll be an ambassador in a different way. कारण मागच्या फर्स्ट कॉम्पिटिशनला मी माउथगार्ड घातलं होतं, हेल्मेट पण घातलं होतं आणि जोरात किक बसली TMJ वरती. 8-10 दिवस नंतर TMJ गात होता माझा, पण I got saved because of that mouthguard. So I can definitely vouch and I'll be surely talking about it. व्हिडिओ त्यांनी एक छोटं रील केलंय माझं तिथे कॉम्पिटिशनच्या वेळेस. So thank you very much. And I'm happy I'm with all of you, and best wishes.
My name is Bhakti Muzumdar. I'm a pharmacist, nutritionist and a diabetes educator. I completed my pharma education way back, 20 years back. And I worked in corporate for almost 10-12 years before shifting to Pune. And then after coming here, I completed my MSc in Nutrition and Dietetics with a gold medal. And since then I'm practicing, for the last 6 years I'm practicing into clinical as well as sports nutrition. Yeah, thank you. Very happy to be here at NSDC. Thank you.
I am Dr. Urusai Namdar. Like, I am a dentist and I have my own clinic in Kondwa, Pune. Like, I am the ambassador, like a new ambassador for NSDC. Like, I all the best member for our team. Thank you.
People you see in the church, they are all our members.
We are just new members, so getting introduced to the platform recently. Good morning everyone, I am Dr. Rutuja Gupte. My clinic is in Barnair, Pankar Club Road. I have been practicing clinical dentistry since last 20 years. I was a consultant in a hospital first. I have done my fellowship in oral implantology. And both my kids have been into sports, and my son has already broken his central incisors. So the moment I got Dr. Sneha's message, my daughter was the one who forced me, no, you have to do this, because we have a case at our home. So I have been trying, and I'm getting a mouth guard done for him now, because he's using braces. So and I am trying to promote a dental camp for his soccer academy. So let's see how it works out, and thank you Dr. Sneha for a wonderful platform which is absolutely needed for the current age. Thank you.
Hello, good morning. I am Dr. Shaina Nimkar, MBBS, MD Pathologist and a certified nutritionist. I practiced in Vile Parle for last 40 years, and then recently I am shifted to Pune. Last 5 years I have been associated with one NABL certified laboratory. From that laboratory I conduct a comprehensive health checkup for every person, and they know the parameters, health parameters, they know their life history, lifestyle, and then customize the diet plan and email to them. So this way my practice is going on in Pune, and I am very happy that Sneha has invited me here.
She's our senior most person. Every round of
I'll be really interested in getting the nutritional tips, you know, like how these nutritionists are here. And people come to me for, usually for ailments, but I would like to know what a marathon runner requires, what a badminton player requires nutrition-wise. Thank you very much.
Very good morning. I am Dr. Gayatri More. I am a general dentist and practicing in Pune for the last few years. I am attached to Mymar Medical College and Dr. Babasaheb Sardesai Rural Hospital for the last 18 years. I am a member of IDA Pune branch for the last few years. And then I have just attended ambassador course for sport dentistry. I am a member of PACE Foundation, and I run my anti-addiction programs for the last few years. Thank you and best wishes. I am also a badminton player. I'm just and badminton is my passion. That's why I just chose to attend this course. Thank you.
Everyone, myself Dr. Darshina Shah. I have completed my MDS in oral pathology and currently working as assistant lecturer in Siaga Dental College. I am doing a part-time freelancing. Thank you so much, ma'am, for giving this opportunity. Thank you.
Good morning, everyone. I'm sorry I'm showing the gun right now, but I'm taking the guidelines of Sneha. They will come. I'm a little too seriously. My name is Vinesh. I've basically completed my Masters in Sports Science from ISST Pune, Institute of Sports Science and Technology. Currently working as the head of Strength and Conditioning Department at ISST itself, my alumni. Brief about my profile: I have been working for the past 6 years. I've been the lead SNC coach of Sports Authority of India. I've gone to work with the Indian women's hockey team, A team, for the Commonwealth Games, and recently the concluded AFC qualifiers for the India Under-20 men's football team. I was a part of the camp as well as the SNC coach. A brief stint with the JSW Sports Inspired Institute of Sport as the assistant SNC coach. And we are working with ISST, and Sneha Divakar ma'am is a part of ISST. She invited me, and I was glad to be a part of this conclave. And basically, just to give you a brief, that ISST is a educational institution and focuses on athlete performance as well simultaneously. Thank you.
I am under ISST, so as he said, I conduct my 1 year's program. So I started that journey 6 years back. So it was a very tough journey. Some of you know about it. That earlier it was a 3 months course. Then we came up with a 6 months diploma course. And now I'm very happy to say that last year we launched a complete 1 year hybrid master's training program. So thank you so much. Next, please.
I am Sachin Neuragaonkar, Prani Killer and Wellness Consultant. I am into Prani Killing from last 10 years, and we have served more than 5,000 plus clients. We have taught more than 1,000 plus people meditation, and I would like to join NSDC because I have seen that there is no Prani Killer in that slide. So, सगळ्यात कठीण गोष्ट ही आहे की जेव्हा इंजुरी होते तेव्हा परत स्पोर्ट्स मध्ये वापस येणं आणि तो पिरियड फिजिओलॉजिकल आणि सायकोलॉजिकल पण तर त्याच्यामध्ये प्राणी हिलिंगची खूप चांगली हेल्प होऊ शकते आणि प्राणी हिलिंगचा USP हा आहे की याच्यामध्ये डिस्टंट हिलिंग आहे म्हणजे तुम्हाला कुठे जाण्याची गरज नाही जगभरातून तुम्ही कुठून पण हे सेशन घेऊ शकता तर मला नक्कीच जॉईन व्हायला आवडेल थँक्यू
On this occasion, I would like to announce, now that everyone is saying, that जसं आम्ही डेंटिस्टना मेंबरशिप आमची ओपन आहे तसं now we have a category associate member. So all sports science or any healthcare professional other than a dentist, coaches even if they are interested. So 1 year ची associate membership आहे 1,000 rupees. So त्यामध्ये you can associate with us for any events that we are conducting, any programs, any workshops, athlete related. म्हणजे आम्ही जेव्हा dental camps ला जातो तेव्हा आमच्या बरोबर येऊन ते सगळं exposure तुम्ही अनुभवू शकता. So for that you have to be our associate member. So I would really like to have a lot of people here on board for the same. Sir, please.
Hello everyone, good morning. Myself Shraddha Erende and I am a dental intern at Silver Dental College.
Arnold sir, please.
My name is Arnold Lobo and I am in martial arts for last 30 years. And I am a black belt 5th dan from Japan Association. And secondly, I have done my BPA for sports and now I am truly in martial arts. I am hoping to spread out my martial arts in different fields. So this is a good platform. So when Deep Lakshmi told us, so I told let's have an introduction and if it suits us, we will shoot up. Thank you very much.
Thank you sir for the opportunity. So at the Republic Cup 2025 Maharashtra, we got the opportunity to do dental checkups at Balewadi Stadium. So thank you Deep Lakshmi and thank you Arnold sir for that opportunity. And we were looking forward to many more such opportunities with the rest of you guys also. Come sir, please. Yes.
My name is Dr. Venkat Seshan. I am a director and founder of Shivlas Physiotherapy and Fitness Clinic, Arvinagar. And I am into the sports physio since last 26 years. And I have been a physio for many international ITF events and ATP Masters and a lot of international triathlons and duathlons. So it knows me very well. So I am just come here because of ma'am and the one of the panel members, Dr. Sachin Tapasri. And Geeta ma'am, I have heard about you a lot, but it's the first time I'm going to meet you. And Richa is the first time we are meeting. I just spoke to her 2 weeks before. So it was really great to meet you all. And thank you so much for giving me this opportunity. Thank you, ma'am. Good luck for everyone.
Thanks a lot, sir. For I have told Dr. Sachin Tapasri, who is our honorary member, as you saw. I told him, sir, please send at least one representative from your people that are there attached, associated with you. So he graciously accepted that. So I'm really thankful for coming here. I think, yes, please.
Hello everyone, my name is Dr. Purva Ketkar. I am a homeopathic doctor and I have been practicing past 15 years and I am based out in Bowden. And my second vertical is parenting counseling, with which I interact with parents whose kids are into sports. So exclusively I am into sports counseling as well. Thank you.
And most important, माझी cousin आहे.
Thank you, Sneha, for inviting me here.
My name is Priyansh Pandya. I am a strength and conditioning coach from Australia and USA. Before that, I was a professional cricketer, played for Gujarat Cricket Association at under 19 age, and right now I am working in Pune for last 8 months. Very beautiful. Thank you for inviting me. Thank you. Glad to know more about NSDC.
माझं नाव प्रवीण देशपांडे आहे आणि मी स्केटिंग फील्डमध्ये 35 वर्षापासून कोचिंग करतोय. मी स्वतः नॅशनल चॅम्पियन छत्रपती अवॉर्डी आहे. आदित्य सर आले, त्यांना थँक्स केले, त्यांनी इन्व्हाइट केलं बरोबर. आणि मला NSDCला पहिले बेस्ट विशेस द्यायचे, कॉंग्रॅच्युलेशन्स म्हणायचे. हे चांगलं एक प्लॅटफॉर्म तयार करतात आहे सगळ्यांना एकत्र आणण्यासाठी, त्यांना बेस्ट विशेष आहेत. आणि स्केटिंग माझा गेम जो आहे फार ॲग्रेसिव्ह आणि हाय स्पीडचा आहे. तिथे डेंटल झोनमध्ये मला आदित्य सरने ऑलरेडी भरपूर गाईड केलेलं आहे. अँड विल बी लीडिंग दिस कन्सल्टेशन आणि सगळे सपोर्ट लागणार आपल्याकडनं. आणि बाकी पण स्पोर्ट्स रिलेटेड अनेक लोक सायकोलॉजी आणि फिजिओ स्ट्रेंथनर आलेले आहेत. सगळ्यांशी मला भेटायला आवडेल अँड या प्लॅटफॉर्ममुळे आम्ही आमच्या ॲथलीट्ससाठी चांगलं काही करू शकतो आणि इंटरनॅशनल लेवलही चांगलं करू शकतो. एनिवे थँक्यू. गुड डे.
Dr. Shraddha Kale, practicing in Keshav Nagar, Mumbai from the last 6 years. And thank you so much, ma'am, for getting us all together on a Sunday morning. Thank you. Only dedicated people like you and your team can do this. Thank you so much.
I'd like to introduce myself. I am nowhere close to sports field, although my mother hoped that I would. And I clearly, according to her, I got the wrong genes. I'm into dance. I did BA in my Bharatanatyam along with doing MBS in periodontics. But I very safe, not injured yet. But I have a special interest in traumatology, and I was interested in sports dentistry in my 3rd year. And I am very, very glad to be associated with NSDC and Sneha madam, because it's a very hardcore sports field in which I think very, very practical based, not just theoretical. And I'm glad that I got to hear about all of you also. I'm very glad to meet you and hope to associate you in the near future also. Thank you so much.
Okay. I'm a second generation dentist. My father runs a practice at Apte Road. So we have a legacy of 42 years, more than 42 years. So my association with sport is like, our family is a very sport-loving family. So that is why sports has been there in our family since ages. My grandfather, there was a time when me, my father and my grandfather, 3 of us used to play tennis at Ferguson. This was the legacy. So when this branch was introduced by Sneha ma'am, immediately when I read about it, I immediately called her. I want to know more about it. I want to give something. When she also had a concept on NSDC, I was really happy that I'm the part of it. So yes, and thank you very much all of you for coming. I'm happy. I'll be looking forward to collaborating with all of you. Thank you.
So he has been, as he said, a very stringent follower. And the funny thing is, so when we introduced the certificate course, he enrolled for it. Then when we introduced the diploma, it is an upgraded version. He immediately enrolled for it. And now when we introduce the master's program, again he has enrolled for the same. So yes.
Good morning everyone. I would like to introduce more about Sneha, because I remember the first discussions which we had, where the inception started. It was during a fashion show practice of Indian Dental Association Pune branch, where she had this particular idea that, sir, we should have something like a sports dentistry and a sports dentist. So after that, we had her first talk in one of our Maharashtra State Dental Conference, which was held at Oxford. So I had seen her taking lot of efforts when no one knew about sports dentistry. She took lot of efforts, got herself trained, is now making people aware. So let's put our hands together, a big round of applause. You are doing a great work. And for any branch, I think there are few, we call it in our organization a four-pillared growth. One is awareness. Public awareness. People should know about your branch. Second is visibility. That means either in form of social platforms or events. Third is continuous updation, which they are doing. And fourth is research. And I will tell you one thing. If you have seen American football, that is rugby, what we call it as, there are special helmets, and they never used to use mouth guard. So there was a study which was done in 1980s where they found that they suggested use of mouth guard. So the players were saying that I am using such a packed helmet where there is no chance that there will be any trauma to the dentition. What they found is that even if you have got a hit on the back side of your head with a ball, the first reaction is clenching. And if you have a mouth guard, the clenching which prevents trauma to the dentition, at the same time they have seen that even though there was a hit on the back side, because of a sudden clenching, there was a temporal fractures which was seen, and that is the reason they started. So this was the role of research, and then when they did this particular research, they presented a white paper to the government, and that is when their organization started making mouth guards along with helmet compulsory. So I think it's a good beginning. You should have data also. Those who are using, apart from this, if you have this data, it will help in research. At the same time, it will give data to give it to the government and the authorities, stressing the role of this particular branch. So I think these are the four pillars this organization and the committee should look for. You all are doing great work. Your team is amazing, and wishing great success to your organization. And in my introduction, no one knows I'm an accidental dentist. I am a cricket player. I was under 15, under 17, used to represent Maharashtra. I played with Sachin Tendulkar, Vinod Kamble. They used to be my thing. So I had a serious career switch planned at that time, that I'll switch from science, take up commerce and take up cricket as a career. But somehow this I'm talking in 1988 when we were in 12th standard. So my father said that currently probably there is sports, you will just play for Maharashtra Ranji, then you will do a job in bank, and then evening you will do the coaching. That time IPL and other, because we had examples like Raju Bhalekar Dada, Bilin, Shrikant, so there was no scope. Now we have Kedar Uttaraj doing it great. So that is where I thought, okay, I should concentrate on science. So that is how I am an accidental dentist. So that is how my relation with sports, and I am an avid sportsman. So I really love this particular branch. Thank you very much, and wishing you a great success in this branch.
Yes, so as he said, research आणि ह्या ज्या सगळ्या गोष्टी आहेत त्या करण्यासाठीच अगर आम्ही ऑर्गनायझेशन स्टार्ट केली आहे. Because see, when I started about sports dentistry, that was way back in 2017. So I myself didn't know much. So from that journey to now, it has been a long, difficult journey. And so when I started taking the course, because I wanted dentists to become aware. But in a period of 5 to 6 years, what I realized is that yes, every year a handful of dentists are doing the course. But then still it's what I wanted, that the rapid spread of national level awareness. So that was not happening by just taking the course. So I was restless. I was not very satisfied that काहीतरी अजून missing आहे या सगळ्यामध्ये. It's not still working out the way I want it to. So I had actually, these guys know the journey, because I had tried to associate with various other dental organizations trying to tell them the importance that let's start sports dentistry under you असं करत ऍक्च्युली हे उशीरच झालंय माझ्या दृष्टीने ऑर्गनायझेशन सुरू करायला. बट what I eventually realized was ki see, for every organization their subject, they have their priority as their subject. सो जरी कोणाच्याही अंडर जरी चालू केलं तरी शेवटी त्यांच्यासाठी त्यांचा सब्जेक्ट हाच महत्त्वाचा राहतो, ह्याला सेकंडरी ट्रीटमेंट मिळते. सो थोडं म्हणजे वैतागले असं म्हणायला पण हरकत नाही. आणि देन आय डिसाइडेड टू इव्हेंच्युअली टेक द मॅटर इन माय ओन हँड्स की काही वर्कआउट नाही होते तर आपल्यालाच आता ह्याच्यात पडायला लागणार आहे. आणि व्हॉट आय हॅड डन ॲट दॅट टाइम वॉज दॅट असोसिएटेड विथ व्हेरियस स्पोर्ट्स मेडिसिन अँड स्पोर्ट्स सायन्स ऑर्गनायझेशन्स. आय बिकेम पार्ट ऑफ मॅम्स ऑर्गनायझेशन आणि ISSCM जे आहे, I have been associated with them since last 4 to 5 years. So on their platform, आता the webinars post 2020, lot of webinars have happened everywhere. So ISSCM चे जेव्हा webinars झाले तेव्हा I have been the one who has been delivering lecture on sports dentistry for them. So one day it just clicked me, it just hit me because there is a consensus statement that came out in 2020 by the Academy of Sports Dentistry and European Association of Sports Dentistry along with the European College of Exercise Physicians that it is necessary to integrate sports dentistry into sports medicine. So this consensus statement was passed out in 2020. So it just struck me 2 years back roughly that if this is the consensus statement, then why not let's launch under a sports medicine organization. And since I was already associated with ISSCM since many years and I have been giving webinars under that platform, so I knew them quite well. So I directly approached their president saying that what if we start a sports dentistry committee. And that is why this is not actually named as an association, it is a committee because we are officially the dental wing of ISSCM. That is why it is called a committee and not an association. So I told him, Dr. Varun Sharma, who was that time the president, so I asked him that can we do this? You discuss with your EC team about this and then get back to me. So he got back to me within a few days and they liked the idea a lot. And they liked the idea so much that in what they did was in their WhatsApp groups when we officially formed an MOU and everything. So in their WhatsApp groups they circulated that we are starting with the dental wing, and similarly if other sports science special like topics like sports physiotherapy, so if they want to start their own wings under us, you are most so that idea just clicked them because see, obviously ISSCM family grows. If they have many subcommittees under them, their family is increasing. So amcha nantar pathopad within another I think 3 to 4 months sports physiology chi committee sudha under ISSCM launch zali. So that was a very good thing that happened. And आता ISSCM international conference झाली. So I got a chance to go to Varanasi. So that was obviously Varanasi होतं, देव दिवाळी होती. That was an amazing experience. That was one thing. And to attend an international platform in India and across the country, all the sports science and sports medicine because they had so त्यांचं कसं युनिकनेस आहे. मी जस्ट सांगते की फक्त त्यांचं कॉन्सन्ट्रेशन स्पोर्ट्स मेडिसिन वरती नाही करत ते. Okay, so they are taking under them all the sports science topics also because हे मी थोडंसं म्हणजे स्पोर्ट्स सायन्स मध्ये तुम्हाला आयडिया असेल की थोडं स्पोर्ट्स मेडिसिन असं थोडं असतं मी पाहिलंय स्वतः. बट सो त्यांनी त्यांच्या कॉन्फरन्समध्ये सगळ्या स्पोर्ट्स सायन्सच्या टॉपिक्सना इन्क्लूड केलं होतं. सो इट वॉज अ अमेझिंग प्रोग्राम आणि खूप मोठी लोक पटियाला NSNIS पटियाला आणि अशी सगळी मोठी लोक भेटली तिकडे. साईमध्ये तर अक्रॉस द कंट्री सगळीकडचे लोक आलेली होती. सो आय एम ऑल्सो गोइंग टू मेक यूज ऑफ ऑल दोज कॉन्टॅक्ट्स दॅट वी गॉट देअर. आणि नक्कीच आपण आणि इकडे बसलेली आज जी लोक आहेत सो टुगेदर वी विल वर्क आउट सम थिंग्स आणि हाऊ टू प्रोसीड, हाऊ टू गो अहेड. वी आर ऑलरेडी प्लॅनिंग लॉट ऑफ थिंग्स. तर इच्छा अशी पण आहे की एक कॉन्फरन्स घ्यायची पुण्यामध्ये ह्या कॅलेंडर इयरमध्ये. सो कसं बिकॉज वी नीड पीपल, वी नीड स्टफ आणि त्या कॉन्फरन्समध्ये डेंटिस्ट्री आणि स्पोर्ट्स सायन्स सगळ्याचे लेक्चर्स आम्हाला ठेवायचे आहेत. सो वी वॉन्ट द क्राऊड टू बी अ मिक्स्ड क्राऊड ऑल्सो फॉर अटेंडिंग ॲट दॅट टाईम. सो डेफिनेटली वी आर ओपन टू असोसिएट मेंबरशिप. सो कोणी इंटरेस्टेड असेल तर मला तुम्ही नक्की मेसेज करा आणि आपण वी विल वर्क आउट इन डिटेल. ओके, सो आय थिंक 9:30 झाले. हां, सो नाव 9:30 to 10 वी विल ओपन फॉर गो फॉर ब्रेकफास्ट आणि 10 to 10:30 सगळ्या स्पीकर्सचे लेक्चर्स असतील. 10:30 to 11 आपलं पॅनल डिस्कशन असेल. त्याच्यानंतर मग वी विल हॅव लिटल बिट ऑफ नेटवर्किंग, अगेन ग्रुप फोटोज आपण तेव्हा घेऊ. ठीक आहे, सो आय थिंक लेट्स ओके, कसं आहे मी ते सेटलमेंट बघते. ओके, विल स्टार्ट विथ रिचार्ड.
Gaurav Najan. I'm a strength and conditioning coach. I have pursued my master's in strength and conditioning from UK. For every time we talk about strength and conditioning, what is that one thing that comes to your head? What do we think when we think about the term strength and conditioning coach or a fitness trainer? What is it that comes to your mind? Muscle development. So usually when we think about strength and conditioning coaches or fitness trainers, the one thing that comes to our mind is muscle development or probably weight loss. Or you will see somebody who's a bodybuilder with 6 packs and claiming to be a strength and conditioning coach. But now strength and conditioning by itself has become a very specialized degree. You know, strength and conditioning means understanding the biomechanics of the sport, understanding how an athlete is moving in the sport, what are the needs analysis of the sport, understanding the physiology of it. So, yeah. So I run a company called Nijan Training Systems, and I've been fortunate enough to work with a lot of different athletes associations over the period of 8 years. As somebody introduced that, I worked with some Olympians in the past, and I've been very fortunate to work with Lakshya Sen for Paris Olympics 2024. We've created history because this is the first ever athlete to ever make it to the quarterfinals in an Olympic event, in an Olympic singles event. So, as I told you earlier that I pursued my master's in strength and conditioning from UK. Can we come to the next slide? So we are a sports performance company. We've all collectively traveled for 300 weeks. And we consulted in Pune, Mumbai, Hyderabad, and Bangalore. So I've been 300 weeks on tour. So I'm not somebody who's based in a clinic or a hospital, but also we've been traveling. So whatever I will be telling you guys will be more from experiences that I've gained over a period of time. Next slide. So, before we start with anything, it's important that we have some sort of diagnostics. We run diagnostics. Just like how we go to a doctor, how we go to a dentist, there are certain diagnostic tests that we run to come with a certain report that what all things do we have to work with. Similarly, when it comes to athletes, this is Lakshya Sen. As you can see, we went to a performance lab which is based out of Austria, and as you can see, they've got some high-tech equipments, that we do not have in our country. So, we can now, of course, calculate a lot of physiological markers, but we can also calculate a lot of strength markers and power markers. So, one thing that you'll be hearing from me a lot is, calculating forces and power and how do we measure it. So that's what we did in Austria, and guys, I've never seen a report which is in detail. We had a 42-page report saying that what muscular issue that an athlete can face, what are the strength levels that we have to work on. Because when we talk about strength, it's just not one strength. As we know that A muscle moves concentrically, isometrically, eccentrically, and it also moves in a reversible order. So what part of strength that we have to work on, after running strength diagnostics, we get that report. So that's me and the entire team at Paris Olympics 2024. As you can see, that Lakshya Sen, Coach Vimal Kumar, Prakash Padukone, and me at the Olympic Village. And as you can see on the far right, we've got DK Sen, who's Lakshya Sen's father. Just one of the photographs before we started an Olympic trip. Next, please. That's me again with Lakshya Sen in the Olympic Village. So anybody who's interested to know how does an Olympic Village looks like, that is an actual footage of how an Olympic Village is. So we've got like a building, and in that building, depending upon how politically strong you are, you're closer to the cafeteria or closer to the So unfortunately, we are still a developing nation, so we've been given a place in the village accordingly. So, what were the facilities available? Of course, there's a lot of performance analysts, we've got sports psychologists, we've got a lot of recovery centers, we've got strength and conditioning centers, sports medicine stuff, all of that, but we do not have experienced people. Right? When we talk about going to a physiotherapist or going to a strength and conditioning coach or going to a nutritionist or for that matter going to a sports dentist, all we need is a lot of experienced people, because what we see in theory is very different from practice. Right? Imagine somebody who's accelerating at probably 10 meters per second, whose mass is 120 kilos, right? And banging on right in front of the face. That's the amount of forces that we're looking at. I cannot actually, say or describe how the forces are, but one thing for sure that every strength and conditioning coach, or for that matter, now you guys will be into sports dentistry, just go and watch the sport. Watch how a boxer, when there's a hook punch coming onto an opponent's face, how does that feel? And probably when a rugby athlete is, in a scrum, so you just go feel it. You can actually hear it when there's a concussion, right? When there's a concussion, for guys, 15 seconds you've got no clue where you are. You've got a physiotherapist here, and then the first thing, what do we ask the patient? What's your name? Where are we? Right? Can you count from 5 to 1? Because the concussion, because the first thing that happens, is that we've got no clue where we are. So how is it possible we are playing Olympics, but we do not know where we are after a concussion? So that's the amount of effort, that's the amount of forces that we are dealing with. So of course, there's a lot of research now that proper clenching by itself can help you, deliver or improve your forces. So we've checked that, with our weightlifters during a clean and jerk or probably during a snatch. So of course, Olympic weightlifting by itself is a different event in which, one more thing, man, there's a very less research that I've come across various athletes, because they are clenching in and out, so they're lifting, they're clenching, they're lifting, they're clenching. So there's a lot of masseter issues which is going on, right? So the inability to open your mouth by itself is an issue, right? You cannot open your mouth and eat, right? 300 weeks means I have traveled all the 7 continents. The food that I see probably in India I cannot eat it in China. So whatever we are eating, we've got no idea what we are eating. We are eating just for the sake of eating. So probably before the Olympics, we went to a pre-Olympic camp in Marseille, and we were there for around 6 weeks. And when I came back to India, my wife told me, let's go eat croissant and have a cup of coffee. And I said, I don't want to have it. Because that's what has happened. 6 weeks just looking at the same food day in, day out, it by itself creates a lot of frustration. And sports dentistry, when we went to Red Bull, it's not very uncommon yet in India, and people haven't heard about it. But when we actually go to centers like that abroad, there's a very in-detailed assessment, not from a sports science angle, but also from a sports dentistry angle. The first thing that they do is, they'll of course take you through a lot of cardiology tests, a lot of nephrology tests, a lot of sports dentistry tests, because that's the base. Has anybody got any clue how much money we are spending on an athlete? So let's say if a person like Lakshya Sen, over the period in an Olympic cycle, how much money have you spent? Just, if anybody can give me a ballpark figure?
5 to 10 crores.
5 to 10 crores, right? 5 crores was just a 1 year budget Rio Olympics. Okay. Just 1 year. So don't be afraid, guys, if your kids still want to play, they still get sponsored. So, but that's the amount of money which has been invested in just one athlete, right? Probably there must be one, just an individual sport athlete, but we were 14 of us, right? There was a team of 14 members traveling to Olympics, right? So missing that game time, or not playing that sport on an event where they have to perform because of a dental issue, right? I am going to get fired for sure. So of course, now with the help of ma'am and with the help of all your dentists, we can all collaborate. We can now look into all of these things, and the first thing that we can, we can take our athlete for an detailed assessment, dentistry assessment as well. So that was our team. That's me, Lakshya's mother, Lakshya Sen, BK Sen, and we've got a very funny Korean coach with us. He by himself is a 2 times Olympic silver medalist. Charge around 20 lakh rupees per month. So if you think doctors earn more than coaches, so that's a myth. So play a sport, or make sure your kid plays a sport, so that they can earn more than doctors or engineers. My wife will hate me for this because she herself is a doctor. We got Coach Bimal Kumar, who was the chief coach of Lakshya Sen, and we've got the support staff, right from. This is just one picture. I have another picture of around 23 members. I don't have it in the slide, but that's about it, guys. So that is strength and conditioning, and that's how evolved we have become over the period of time. And we are looking forward to collaborate. Not even we referring people to you, but now you know who strength and conditioning coaches are. The next time you hear a strength and conditioning, don't take them to a bodybuilder. Take our number, and probably we can collaborate. We can help them better. Yeah. Thank you so much, guys. Thank you.
Mine is a little bit longer. Please bear with me. Yes, good morning everyone. I'm Dr. Richa Kulkarni. I'm an international sports physiotherapist, consulting physiotherapist, and an ergonomics advisor. I have my clinic here in Pune on Kadve Road, and I'm running since 4 years after coming back to India in 2019. In total, I have 15 years of experience in this field, working with hospitals, working in sports, and working for the teams. Internationally, I have worked in football. So I have done 2 football World Cups with the international team. I would be proud to say I got to represent an international country where I was residing. I had there 2 national teams, under 23 men's team and senior men's team. So I got to be their international sports physio in 2019. So with under 23 men's team, I had the privilege to go to Myanmar for AFC Championship. And we all know FIFA Qatar happened in 2022. I had the privilege to travel with their senior men's team for the FIFA World Cup pre-qualifiers in 2019. And that's how I completed my international project and came back to India, and then started my own venture, Kinesis Sports Rehab and Physiotherapy Clinic. Here domestically, being a badminton player myself, I work extensively in badminton, and recently we have ventured into rugby. So yeah, next. Yes, and in 2023, I I had the immense privilege to be on the platform of Olympics. Not Paris, but I was in the Special Olympics. So along with physiotherapy, I am working into sports management as well. So when India hosted 2 football World Cups in 2022, I got to be the liaison officer for national team of Thailand in AFC Asia Cup. And in FIFA Under-17, I was the liaison officer for France Under-17 women's national team. So that's how, and then on the same platform, I got selected individually for Special Olympics World Games. There I was into roller skating sport, and I got to witness India winning gold medal, silver medal, bronze medal. Yeah. Next. Yes. So before this, according to you all, what is physiotherapy? What is your perspective of physiotherapy? Yes, anybody? Just in short.
To rehabilitate.
Yeah. But there are a lot of myths about physiotherapists, as you have heard, right? Yeah, that's what I would be covering. But the basic aim of physiotherapist is to make an individual, to make him the ability to move, to reduce their pain, and the main thing is to restore their strength and function and prevent disability. So we are into movement. What is kinesis? Why I have put that name, kinesis, is movement. We learn the main subject for us is kinesiology. Okay, so physiotherapy is all about movement, restoration of your lost function, lost movements. So that is physiotherapy, and I think it is way underrated in India, I would say. Yeah, so as a physiotherapist, I work in this following domains, extensively into sports. Secondly, general physiotherapy, because I have worked for 10 years, I have an hospital experience treating many of the musculoskeletal conditions. And corporate, I do ergonomics, that is posture correction. I give a lot of awareness lectures in companies. Recently, we have done it in, I think, Sandvik Asia and John Deere. So and individual customized lectures also we do. So what do we do in sports physiotherapy? So as I said, domestically I work a lot in badminton, being a badminton player myself. So we give on-field and off-field support to the athletes. So this is these are the recent pictures. If you have heard about the Aminora Cup, which is one of the prestigious tournament of Pune, and we are doing it consecutively for the 3rd year as a tournament physio. Then general physiotherapy, which is for the normal population. Like there are many conditions, but I mostly work into musculoskeletal, not in the neuro, not in pediatrics, mostly in musculoskeletal. Then corporate sectors, as I said, office ergonomics. These are few on-field ergonomic sessions. Next. So what do we provide as a physiotherapist? Sports injuries, its prevention, management and rehabilitation. As he said, we travel with the team. Okay, so it's not only about injuries. When you are traveling with the team, yes, that is specifically injury management. But when we are off field, yes, we do provide preventive therapeutic treatment protocols also. Then yes, soft tissue injuries, management and rehabilitation of musculoskeletal conditions, then many general conditions, post-operative rehab, after fractures, after TKRs, after THRs, and work-related musculoskeletal disorders. Yeah, next. Yes, this is the main slide. The myths about physiotherapy. Yeah. Initially, way long back, there was, when physiotherapy was introduced to the country, there was a practice कि पहले orthopedic के पास जाएंगे, उनसे referral आएगा, फिर physiotherapist के पास जाएंगे. Correct? That was a normal practice. But I think over the period, it has been changing, and it should change. That it is not necessary you need a doctor's referral to go to a physiotherapist. Okay, you can directly come to us to evaluate yourself. Okay. Then physiotherapy is painful. Is SNC painful?
Depends where you
It's the same way. We work in your pain limits. Okay, we work in your pain limits, and it's a myth that it is painful. Yes, for some conditions it is, but we make sure that we work in your capacity, not in our capacity. Correct? Then physiotherapy is only for injuries and accidents. Not correct, right? As SNC and other support staff, they help in your lifestyle. We also help you to prevent injuries and lead a healthy lifestyle. Correct? Then surgery is the final option. No. We have worked with a lot of athletes, lot of normal population where we have made that surgery not happen. I have a badminton coach. I was just asking about her. So she had a ligament injury, she had a meniscus injury. I worked with her for a year. Now she is back to competitive sports without any surgery.
Really?
Yeah, without any surgery. And it was all totally on rehab. And I'm proud to say that.
I should have met you in 2011 when I had my ACL tear.
Oh my God. And the coincidence, when she went back on the court, I said, now you're ready to return for your play. We entered into the same tournament and we were the opponents.
Okay, great.
Like she was playing her first tournament and I was playing in that tournament. We came as opponents and it was like a doctor-patient tournament. And I was happy that she defeated me. Singles is not my forte, but I tried playing singles. So she defeated me and on that she won the tournament. So this is the power of physiotherapy, I would say. And the last but not the least, modernized term for massage therapy. Oh my God. There was a business presentation I was giving and I just asked, what is physiotherapy according to you? Normal population. They said massage therapy. Today, this day they are telling it's massage therapy. Oh my God. That's why I say it is so underrated in India. Yes. So what are the treatment techniques? We provided kinesis. So these are traditional therapies, but along with these traditional therapies, we do practice advanced therapies also. And it is customized to each and every individual. It is not the same for everyone. Okay, so these are few advanced techniques which I practice, like kinesio taping, dry needling. So dry needling, when we are talking about dentistry, sports dentistry, so we do masseter release with dry needling. So that is one of the, you can say, instant pain relief, and it can help in TMJ disorders. Okay. Then MFR, soft tissue mobilizations, and cupping therapy, which is booming again. I think it's the ancient therapy, but now booming again in sports physiotherapy right now. And these are few of my World Cup teams, I would say. This was my first international team, under 23 national men's team. So I was into a country named Timor-Leste. So this country is between Indonesia and Australia. It's a small island and I was working there in a clinic. But being from sports background, I got appointed in their federation and that's how I got their 2 national teams. And this was the only match we had won against Macau. And I used to carry the cell phone so I could take the photograph. That was in Malaysia for the pre-qualifiers. And you said we spent 5 crores behind Lakshya Singh. This was a third world country. They had nothing, but they still were playing. They were the debutant, but they still were playing very, I would say, passionately. They had no sources. No sources. I was the only medical official. We were only 7 officials traveling with the team. So very few resources, but what a passion. What a passion for the sport. So this was again in Myanmar and Malaysia. I had the privilege to meet the Japan doctor when we were in Myanmar. What resources they have. Wow. But that time dentistry was, it's still not, people are not aware about that.
So Japan has a very big sports dentistry association. It's one of the biggest associations.
Okay, okay. And everywhere we had Japanese officials.
Oh.
Everywhere. Yeah, even our head coach, he was Japanese. Yeah. So this was in India. I was the liaison officer for national team of Thailand. So we were in a bio bubble at that time. And we tried to play till quarterfinals, but we just got disqualified at that time. So this was FIFA Under-17 Women's World Cup, which happened in Goa in 2022. So I was the liaison officer for the team France. Yeah. Next. This was my Olympics experience. So that was something phenomenal. It's really, you cannot express it in words. I was able to hold the gold medal. I did not win it, but I was into the medals department, so I could hold at least. So the country which I was in, I had a lot of exposure there, and I'm proud to say the WHO head was my patient there. So he used to come and we used to go to WHO office very frequently in that country. And now here, so if you see those trophies, those are all badminton. She is an elite athlete, a Padma Shri awardee, Sheetal Mahajan. She is our patient. So now elite athletes have started coming to Kinesis. Yeah, next. He is a para international cricketer. Recently, they won the Champions Trophy in Sri Lanka. India won the Champions Trophy against England. He is our regular patient. These are few of my articles which I used to write in Indian Express when I came back to India in 2019. And these are my achievements as a badminton player.
Very nice.
Thank you.
Has been really wonderful insight into your journey and whatever your experiences have been. Now the last word is going to be of Dr. Gitanjali Pide, because sports nutrition is again a very critical component for the athlete. So let's hear it from her, because she's been there around since many years for sports nutrition. So ma'am, over to you.
We've been communicating with each other for many years now, almost 3 to 4 years. So I don't have a presentation, but I'll just share my insights about the field of sports nutrition. So my journey as a sports nutrition first began at the Army Sports Institute, where in 2001 I just got recruited without any interview, without any it so happened that I was teaching in SNDT College of Home Science as a nutrition faculty, and there was a colonel, Dr. Colonel Rana Chengappa, who is now based in Delhi. He just visited our department and he wanted somebody to work as a sports nutritionist. And in 2001, just after 2000 Olympics, when India won only one Olympic medal, the army took this as a responsibility. They had a lot of land near Mundwa, and they thought that they should actually use this land and convert it into a sports facility where they can train, and that is how the Mission Olympics wing was started by the Indian Army. And I am very proud that I was the first civilian to be appointed in the institute. So when I started my journey as a sports nutritionist, there was nobody else, and myself and Dr. Rana Chengappa, who is a very well-known sports medicine specialist, we used to share a table. Either he sits or I sit on the table. So that is how it was, and we were also working along with the Tri-Services facility, which was across the road. It is near Ghurpadi, and we used to shuttle offices there, and that is how my journey started. I converted the langar into a sports mess, and we had, within 2 years, we had the first Olympic qualification, that is 2004, Tarundeep Rai was qualified for the Olympics. And then later on, it was converted into a big institute, which is there now. If you travel there, on the Koregaon Park Road, you will see a big institute of 7. They have more sports disciplines. I see Mitali has also worked there. She's also, yes, they have 7 sports disciplines. We started with 5. And the aim of this particular institute was that since India probably is not good at team sports, so it's better to concentrate on individual sports and groom them, catch them young. So I had this opportunity to work with Cuban coaches, a sports medicine doctor coming to Army Sports Institute with whatever minimal facilities that we had that time. And probably we were the first one, we actually thought ahead of time, and we had this body composition analysis, and I used to do the reports of the body composition analysis. We had a biochemistry assistant who used to do the lab reports. We used to do blood urea levels before training, after training. I myself standardized a method of assessing the antioxidant levels in the athlete with the help of Dr. Kalpana Joshi from the School of Health Sciences in the university. And at the same time, while I was working with these athletes, I enrolled for a PhD program with Mumbai University in College of Home Science, Nirmala Niketan. And I did simultaneously, I had 2 jobs. I was a faculty in SNDT, a part-time faculty, and mornings was Army Sports Institute. So I shuttled between Karve Road to Khurpadi every day on a 2-wheeler. And I finished my PhD around 2007. It took at least 5 years for me to complete my PhD. And that PhD work is quite well recognized, and that won me 2 awards. That is the Experimental Award from National Nutrition Society of India and the J. N. Bose Memorial Award. So taking it forward, so this is how I started working with grassroots level athletes. So where communication was always a challenge, boys never used to talk. There was a challenge, and I think it still persists because most of our talent comes from the grassroots, and they are the ones whom we need to groom. We see that there is a lot of potential in other sports, but main potential is at the grassroots. So I know how a talent scouting camp is done, what are the parameters to look in, and how to groom them, to set a communication, coming a female, coming as a person to teach you what to eat. There's a lot of resistance from the coach's side, still there is, and as a working sports nutritionist, and the most challenging aspect of sports nutrition and any other branch of nutrition is there are many self-made nutritionists, because they do certificate courses and they do nutrition, but they should understand that there is 5 to 7 years of training that goes into nutrition. And I have never myself said that I have learned or done a course in sports nutrition. I have learned sports nutrition on ground by doing a PhD, but whatever I have learned is working with the athlete, being with them on the ground, being there in the morning, seeing the training. Now, considering the role of a sports nutritionist, many people here associate sports nutrition with supplements, and which is entirely wrong. Because anybody goes for a sports nutrition consultation will be prescribed a sports nutrition supplement, but that will be based on the proper analysis. So we have a protocol to analyze and give a nutrition intervention for athletes. First is to understand what is their body type, what is their body composition, how is their physical fitness level, understand their training routines, what is the goal, whether it is a pre-competition comp. So we have how you have a periodization cycle for training, we also have a nutrition periodization. So we periodize the nutrition requirements based on the training program. So the first question a nutritionist asks an athlete or a parent is what is the training cycle, because most of the parents are not aware of what is happening to their child's training and what the coach is giving. It is also important to note for coaches that coaches make a lot of mistakes because the scientific aspect of training is still lacking. So when to peak, we see a lot of worn out patients, the clients or boys athletes who get worn out within 2-3 years of playing and they don't play further because they get injured. So nutrition plays a very important role in prevention of injuries, grooming the athlete right from the young age, and we should know when you have to peak. Like for example, the strength and conditioning coach will know when to peak the athlete or what time it is to peak. But in a country like India, when people are not aware of when is the competition, हम तो पूरे तैयार हैं, पीक में आए हैं, लेकिन मैडम कंपटीशन कैंसिल हो गया है अभी 2 महीने के बाद. So here nutritionist plays a very important role, that how you support them to sustain or what is to be done. Because a lot of time athletes do come to peak and then again they have to change the training. This is quite disheartening to them, and getting back to competition. And India's scene in sports is sometimes good but sometimes very bad, because till the athlete actually books the tickets and is on the flight, he never knows whether he is really going for the competition. So that is the main challenge that we face. And also parental pressure, I feel those who are nutritionists here will definitely agree with me that we are more of psychologists. And it's not that we are only a nutritionist, because a nutritionist will ask hundreds of questions before actually making a nutrition plan. It is, during the lockdown, when I was doing online consultations, my daughter told me, what is this? You are asking a lot of personal questions to this. When do you go to the loo? What is, all these kind of questions you are asking, and what do you understand from all this? So she was really very unhappy with my interactions with my clients. So she said, you are earning money by asking them unnecessary questions. So this is how it is, but nutritionist has to know all this. So I think a nutritionist has got a very important role to play as a team of the entire sports sciences support staff. Now regarding my work, apart from doing the initial work at the Army Sports Institute, till this month of December, I was with the national rowing team, and we had Balraj who qualified for the Olympics. I have also worked with Olympian Dattu Bhoknal and many other people. I also take nutrition workshops for different coaches. I was in NIS Patiala last week for conducting a boxing workshop. And apart from that, because of my background in academics, I have written a textbook, Nutritional Guidelines for Sports Persons, and that is used by many of the colleges, and it is used as I think it's by many nutritionists also. And we have an Association of Sports Nutrition and Fitness Sciences, through that which we run a course, a sports-specific nutrition management course, and we have had a 5th batch which just finished in December, and it's a very extensive course, and it is a very practical course, because we don't teach theory in that course like we start with carbohydrates, proteins, fats, but what is practical and case study based approaches involved in that particular course. So this is the course we run, and I work with a lot of young athletes as well as senior and elite players. So this is all about me.
Wonderful.
Thank you, Madam. As you all realized that she is having a lot of extensive experience in sports nutrition. She is a very good guide and mentor, and her book is also fantastic. I'm also reading it. So I think we'll proceed to the next segment. So we come to the last segment, that is the panel discussion. So in this, please.
Coming to the last part of this. Okay, so we are coming to the last part of today's program. So how the panel discussion is going to go, that as you all know, our 4 panelists are here and they are expert in their respective fields. So what I am going to do is that I am going to ask each panelist one question, So for example, when I'm asking Dr. Gitanjali one question, so similar dental point of view, similar question I'm going to ask to Dr. Sneha. So similarly it's going to go like that. Okay, so I'll be starting now. So my first question is to Dr. Gitanjali. For which sports are sports drinks or juices needed more? What advice do you give to the athletes regarding consuming of sports drinks?
So, loss of electrolytes, you need something to replenish that. So, that way sports drinks will be required for most of the sports if the duration of exercise is longer. But you can also do away with it by giving the homemade sports drinks like you have lime juice. But the mixing has to be correct. They should not be very sweet. So we see that when you make a sharbat, you will add more sugar in it. So that is not the amount of carbohydrate, but you need a isotonic sports drink. So it is used for all types of sports. It's not specific to anything.
Sneha, what is the effect of sports drinks on oral health and how can they be modified to make them less erosive?
Said, so that's what the problem is, that many of the sports are needing sports drinks. So we as dentists, we cannot deny that fact. But at the same time, there are certain tips that we would like to share to the audience while consuming sports drinks. One of the most important is the sports drink has to be cold, it should not be warm. Another thing, if while they are consuming it, if possible, try to use a straw so that it directly goes, it doesn't touch your teeth. And please not to have the sports drink and gargle, don't use it as a gargle. That is the worst thing that can happen. And so what we suggest our athlete patients is 2-bottle method. So have your sports drink and take a sip of water, gargle that water and either spit it out or just drink it. So that is the best way to consume the sports drink, because not having a sports drink is not an option. So another thing, yes, of course, excess consumption is going to lead to dental decay and erosion. So for that, along with that, as I said earlier, oral hygiene practices. So the athletes, we usually recommend them to have high fluoridated toothpastes, and in some patients who need, who have severe problems, there are some prescription high fluoride toothpaste also. Like normal toothpaste, they have around about 1,000–1,500 ppm parts per millions of fluoride. So there are prescription toothpaste like they are having 5,000 ppm fluoride. So if need be, if there is such cases do arise, then we have to prescribe them that kind of toothpaste. So the oral hygiene has to be slightly modified, and then they have to be motivated for that.
I would like to add one point, and very important point, is that you said you should not gargle, but we have a concept of mouth rinse.
Mouth rinse.
Even worse. Because that helps to trigger your central nervous system, and that helps to actually have a better concentration. And this is best used when athletes cannot actually gulp the sports drink, or they cannot consume too much amount of
okay.
So
I think the best solution for this is to drink water after that.
Yeah, so 2-bottle approach is correct, but not gargling or mouth rinse.
See, now this is new things.
Also, it can distract you from having cramps. So if you're just rinsing sodium, which is so it can distract you from.
So actually, in case of hockey, the Olympics in 2021, so that time the Indian women's hockey team had used this Gherkin's solution. So that was taken before the match. So it is a highly concentrated. It's a pickle juice.
Oh.
So it helps to be.
Just try it out.
It will have a very sharp, piercing taste.
Oh God. So guys, that's why we are having this panel discussion, because you get all around point of view from every field. So that is why we are having it, so that you get everything at one place from all the experts. Okay, so carrying on, my next question is to Dr. Richa. That why do athletes do mouth breathing, and how can the habit be broken?
we are into a high intensity sport, okay, there should be enough oxygen. We need a lot of oxygen during that. So, as you asked, because we are into a high intense sport, we need a lot of oxygen at that time, and nasal breathing do not provide that much of oxygen during that. So that's why I think sports athletes do, especially running, yeah. So because to balance that oxygen need, I think that's why the athletes do mouth breathing.
We have to go without me.
I think they I think it is very difficult to break that pattern. If we break that, I think the performance will be affected. So we need to balance somewhere between mouth breathing and nasal breathing. We need to train that athlete accordingly, and we need to increase the lungs capacity so that we don't do much of the mouth breathing at that time.
So I know I do some kind of running.
Yes.
So I recently did my 10 kilometers.
Yes.
So till 5 kilometers I was like okay. I was breathing through my nose. After 6 kilometers or so, I started with the mouth because I was comfortable with that. I tried breathing through my nose; it was not possible. So that is yes.
Just stop breathing through. So as swimmer,
yes,
during fight competitions, it's very difficult because mouth guard is there.
Yes.
So तेव्हा तर अजून वेगळं feeling
Yes. That's why
you need the sensoriums and many things, the focus and a lot of things there. Maybe we could be focusing on all aspects pre-fights.
So here your lung capacity matters.
Correct. Because I do pranayam, so that helps me there.
Yes.
So my next question is to Dr. Sneha. What are the effects of mouth breathing on oral cavity, and what can be done about it?
In sports is affecting the teeth. Yes, so again the same problem. So एक दोन गोष्टी आहेत ह्याच्यात. एक तर hyposalivation because of the exercising habit and the fight and flight response that our body triggers while exercising. So firstly there is hyposalivation. Secondly, mouth breathing. Everything is exaggerating, and because it is not a one-day thing. It is happening every day, day in, day out. They are breathing through the mouth. The saliva production has reduced. This in itself is the biggest risk factor for decay and erosion to happen very fast. Like it just multiplies it 3 times, 4 times more. Okay, so now again another problem. Yes, so as you said, retraining for certain sports, it is important. Sometimes they just get habituated, which is where it is not needed. We have to stop that, retrain, and and of course because of hyposalivation also. So there are specific hyposalivation dry mouth rinses that are available of various brands like Oral-B, Biotene, and all these brands are there. So we check the athlete's oral health and we take their history about all these things. We check their habits, whether they are mouth breathing or not, and what is the oral status. So if they are having any gum infections, if the decay is spreading a lot, and if they are not able to, the transition from again shifting to mouth breathing till nasal breathing, so we have to recommend them these kinds of rinses. First of all, to keep their oral cavity moist. Okay, and another thing, again as I said earlier, fluoridated mouthwashes they have to use, because and there are certain lozenges or chewing gum is also available. And the last stage for dry mouth is to give pilocarpine drugs. It's a small tablet to stimulate the saliva and keep the mouth moist, because keeping the mouth moist is a very critical factor for us to consume food, to stop decay from happening, to stop teeth from getting eroded. And as he said about the swimming, again swimming itself is a big issue, because of the chlorinated water, the teeth are continuously getting eroded. So even all swimming athletes, a lot of these oral hygiene products, they have to use, because it's like we have to really sit down with the athlete and discuss in detail with them and then chart out a customized whatever oral hygiene products they need.
So as you all can see that both the points, but we have to find a midway to reach to it. That is why this panel discussion is there. So my next question is to Mr. Gaurav. Do the athletes have any dental effects at high altitude?
I think there are a lot of times. I'll give you an incident when we were traveling with a few athletes in Switzerland. So at base, when we are playing, at the sea level, everything was completely fine, and we never thought that dental issue could have been a problem for us. But the minute we started going, away from the sea level, somewhere in Switzerland, that's where things started going bad for us. We saw a few athletes were bleeding from the gums, and we had no clue what really happened. So luckily, the FDI is based out of Switzerland.
Right. Yeah.
So we had a lot of doctors, dentists to consult. So it's in Switzerland, you just cannot walk into a dentist and tell them, I've got this issue. And even if you walk in, it's 1,000 francs. So paying 1,000 francs, it's a lot of money. But luckily, somebody came in, volunteered, couldn't do a lot, because we were on the tournament. But I think these are all the things that I have seen while traveling.
So same thing. So parodontology is building up of dental pain and pressure at high altitude is what patients experience. So again, 2-3 things before going needs to be done, like as you said, bleeding. So the most so if there are already gum inflammation is present, then it is going to trigger bleeding if they are. So oral hygiene, teeth cleaning or scaling is what we call in technical terms. So before the athletes go for a high altitude training, they have to get their teeth clean or scaling so that the gum inflammation is reduced, so that they don't land up with any kind of gum bleeding. Second thing, if they are already having any decay in any of their teeth, okay, so that they need to do restorative treatment, because if that tooth remains open and as you said, at sea level, nothing will happen. But that same tooth, high up, it is going to start hurting or it is going to cause skin sensitivity. Then those patients who are having gum recessions and already sensitive teeth because of many years of maybe clenching or if they are any other type of stress is there, their bruxing is there. So for any reason, if they are already having a lot of sensitivity in their teeth, then at least 2 to 3 months prior to them going, as I said, a high fluoride toothpaste and that kind of, you must be knowing tooth mousse. Tooth तर आठवत असेल GC जे आहे ना, GC कंपनीचं tooth mousse असतं. All dentists know that. So it is not exactly a toothpaste. It is a dental cream. म्हणजे ते टूथपेस्ट म्हणून नाही वापरायचं. इट इज लिटरली बोटाला घ्यायचं आणि दाताला मसाज करायचं. म्हणजे साधी टूथपेस्ट 100 रुपयाची असेल तर ते 400 रुपयाचं असतं. बट देन समटाइम्स इफ यू तिकडे जाऊन धावपळ होण्यापेक्षा इथे 400-500चं क्रीम तुम्ही महिना 1.5 महिना दातांना वापरलं. सो बिकॉज व्हॉट हॅपन्स व्हेन दॅट टीथ बिकम सेन्सिटिव्ह, यू आर नॉट एबल टू थिंक एनिथिंग एल्स. म्हणजे तुम्ही श्वास घेतला तरी तुम्हाला बाहेर गार वारा लागलं तरी तुमचे दातांमध्ये कळ ते डोक्यात जाणार. सो दिस काइंड ऑफ सिच्युएशन इफ यू नीड टू अवॉइड, तो हे सगळे प्रिव्हेंटिव्ह मेथड्स करायला लागतात.
High carb is suggested for which sports, and isn't the texture of food important, and how to advise less sticky food?
Exercise meals, post-exercise, carbohydrate is an important part of the daily diet to help them recover. But also there has to be a combination of protein and it has to be a proper balanced meal. So yes, carbohydrate requirements are much higher in athletes as compared to normal population, but at the same time it is very important that they consume raw food, salads and others, so that will also have some kind of a healing effect. And what was the next question? स्टिकी फूड. बेस्ट स्टिकी फूड असं काही नाहीये. Yeah, we don't generally whatever meal is there unless you are consuming lot of chickpeas, protein bars, all these energy bars or protein bars. Even chocolate can be there. So there are many things that they have to eat. Nowadays we get in those malls you see lot of different varieties of candies. So that can have definitely have a deleterious effect on the teeth.
But it can be used for motivation also, for in a different way actually. If you set goals, नाही seriously, लहान बरेच मुलं आहेत, छोटी मुलं आहेत, किती त्यांना नाही म्हणणार seriously. तुम्ही ना see, I'm thinking on different lines. की तुम्ही हे अचीव करा and then आपलं मोटिवेटर किंवा you can use that to achieve targets also somewhere. When you work, when you, of course, ते सगळे येईलच ओघानी. पण कसं आहे, अचीव मेन काय आहे, आपल्याला परफॉर्मन्स हवाय. टू अचीव परफॉर्मन्स देन यू हॅव टू डू साम दाम दंड भेद. आणि प्रत्येक पर्सन युनिक आहे, त्यांची पर्सनॅलिटी युनिक आहे. तुम्ही जे ग्रासरूटची मुलं म्हणलात, त्यांचे घरचे काय गोळ आहेत, काय आयलंड्स आहे घरामध्ये, कुठल्या बॅकग्राऊंड्स मधून ते येतात ट्रेनिंग करण्यासाठी. मग फूड, आय एम सॉरी टू से की मग ते इट्स लाईक या खेळा करून दाखवा, काय पाहिजे ते खा, मग नंतर ब्रश करा पाहिजे तर. आपण
पण मी सांगू का तुम्हाला, ग्रासरूट लेवलचे ऍथलीटचे दात एवढे खराब
हो, कारण त्यांचं घरचं त्यांना
सिटी ब्रेड मुलांची
अर्थात अहो त्यांना घरी काय आपल्याला पैसे आहेत का, बरोबर, स्टिकी आणि कुठलं काय वेगळंच आहे ते सगळं.
But even athletes at the top, so we have this tennis player, I would not name it, we are playing Australian Open. I open his room and he is eating chips. Literally he is eating chips. Because you do not get sleep. Right? आम्हाला माहित नाही काय होणार. The first thing we get into a hotel room, even the light that blinks, you know, we put a tape on it so that the athlete can get sleep. So as you said, it is a big, it's a big event. I heard it out. Event ठीक आहे, मला 50 लाख रुपये मिळणार आहे after I win this. तोपर्यंत मी 10 रुपयाचा चिप्स तर खाऊ शकतो ना. So you have to balance it out, of course. And
काही दाताचं विकाचं काही तेव्हा येणार नाहीये. तेव्हा परफॉर्मन्स ऑफकोर्स यार, बरोबर, बिग इव्हेंट, अख्खं तिकडं टीव्हीचे कॅमेरे आणि जग बघतंय सगळं, ऑब्व्हियसली यार अँझायटी लेवल्स आर गोइंग टू बी एक्स्ट्रीमली हाय. आणि पर्सनलाइज काउन्सिलिंग, पर्सनलाइज म्हणजे इंडिव्हिज्युअल पर्सनल सायकोलॉजिस्ट आणि हे सगळं तिथे रोल, ते प्ले अ बिग रोल. तुमच्या टीम मध्ये हवं असेल तर येते मी.
अवेलेबल नाही तिथे, जसं आहे तसं तुम्हाला मॅनेज करायचं.
That what happens because of frequent carb consumption, and does it lead to a dental decay, and what can be done about it?
आपण हे जे दर 2-3 तासानंतर जे खाल्लं जातं, सो तोंडामध्ये एव्हरी टाइम वी ईट देयर इज ऍसिड प्रोडक्शन, ओके, अँड द सलायवा इज कंटिन्युअसली क्लिअरिंग इट. बट त्या म्हणजे ऍसिड प्रोडक्शनला जर ब्रेक नाही लागला तर ते कंटिन्युअस ऍसिड प्रोडक्शन होत राहतं तोंडामध्ये, ओके, त्याला ब्रेकच नाही पडत. आणि आता कसं आहे, अगेन ॲज आता म्हणजे देर इज नो ऑप्शन की ॲथलीट्सना दर 2-3 तासानंतर खायला देणं हे आपल्याला पर्याय नाहीये, हे करायलाच लागणार आहे, ठीक आहे. सो त्यातल्या त्यात आमचं असं सजेशन आहे, जर टाईप ऑफ कार्ब्स दॅट आर कन्झ्युम, सो ते एस्पेशली आता समजा 10 ॲथलीट्समध्ये 3 ॲथलीट्सना सी कसं असतं. अजून एक गोष्ट सांगते की जेनेटिक्स प्लेज अ लॉट ऑफ रोल. आम्ही असे पण पेशंट्स बघतो की जे वाटेल तसं खातात आणि त्यांच्या दातांना काही होत नाही. आणि असेही पेशंट्स बघतो आम्ही की बऱ्यापैकी ओरल हायजीन मेंटेन करतात, पण तरी सो हा जेनेटिक फॅक्टर त्यांच्या केसमध्ये आहे. सो अशा केसेस आम्ही शॉर्टलिस्ट करतो आणि म्हणजे आमची अशी इच्छा आहे की पुढे पण असंच करावं की त्या जे ॲथलीट्स आहेत की ज्यांना त्या सगळ्या खाण्याचा त्रास होतोय, तर त्याच्यासाठी स्पोर्ट्स न्यूट्रिशनिस्ट बरोबर बसून त्या ॲथलीटसाठी थोडंसं कस्टमाइज की त्याच्यातल्या 1 ते 10 गोष्टी खातात, तर त्याच्यातले 4 गोष्टी आपण जर मॉडिफाय करू शकतो का, तर त्या कशा पद्धतीने काय त्याच्यात आपण बदल काय, कारण प्रत्येकाचं खाणं हे वेगळ्या पद्धतीचं असतं. तर सगळ्यांना मी सरसकट सेमच गोष्ट नाही
नाही सांगू शकत. सो प्रत्येकाचं डाएट बघायचं, त्याच्यात स्पोर्ट्स न्यूट्रिशनिस्ट बरोबर बसून डिस्कस करायचं आणि त्या 10 गोष्टींपैकी जर 4 गोष्टी प्रॉब्लेमॅटिक वाटत असतील तिथे चेंज करायचं. आणि ऑफकोर्स ओरल हायजीन, मी कंटिन्युअस सारखी तेच बोलणार आहे की ओरल हायजीनच्या ज्या प्रॅक्टिसेस आहेत म्हणून त्या लोकांना त्या जास्त इम्पॉर्टंट आहेत, कारण ह्या सगळ्यातनं सुटणं शक्य नाहीये. कारण एका पॉइंटला तुम्हाला स्ट्रेस इटिंग डिसऑर्डर्स हे जे सगळे प्रॉब्लेम्स आहेत हे मल्टीडिसिप्लिनरी प्रॉब्लेम्स आहेत. तर सगळ्या अँगल्सनी आपल्याला ॲथलीटची ट्रीटमेंट करायला लागते, त्याच्यात डेंटलचा पण इम्पॉर्टंट पार्ट आहे.
Yes. And I would like to add one more thing. When a dental pain starts, it is a sudden onset. It can start at any point of time. And when you are stress eating, आपण stress eat काय करतो? Chips असतील, which have got more carbs, which are more dental खूप वाढू शकतो, आनंद मिळणार. Unfortunately, that is not हे की म्हणजे so that is why this balance is important as a whole. Yes. So my next question is to Dr. Richa. How can the TMJ pain be relieved by exercise or massage? How?
So in rehab, जसं आम्ही बाकी ट्रिगर्स ॲडव्हान्स थेरपीजने आम्ही रिलीज करतो. जसं मी माझ्या प्रेझेंटेशनमध्ये म्हणाली, वी यूज ड्राय नीडलिंग टेक्निक्स टू रिलीज द मॅसेटर. सो बिकॉज मॅसेटर टाईट होतो, मग तुमचा TMJ पण टाईट होतो, and that is not allowing your mouth to open. Okay, correct. And then all the other factors are affecting in that. So with those advanced therapies, we help to release all those factors. Then there are few exercises. Then soft tissue mobilization आहे, जे आम्ही passively पण करतो, and when we teach the patient also की self mobilization कसं करू शकतो आपण. And the main part is of breathing. Breathing exercises. The more you are focused in that, तेवढं ते न्यूट्रल राहणार, आणि जेवढं न्यूट्रल राहील तेवढे तुमचे पेन कमी होणार.
That are TMJ disorders and malocclusion related, and what can be done about it?
TMJ relieving through exercises ते तर एक ऑप्शन आहेच. आणि असे आता आम्ही म्हणजे कसं एस्पेशली यंगर ॲथलीट्स मध्ये जे आम्ही बघतो की आता हल्ली काय होतंय, मी एक सिम्पल सांगते, आय कम टू दॅट. काल आपलं जे फोनमध्ये बोलणं झालं की बेसिकली आपलं जे फूड बदललेलं आहे इन लास्ट 200 years बिकॉज ऑफ द इंडस्ट्रियलायझेशन. सो त्याच्यामुळे ना जॉ साईज आपला रिड्यूस झालेला आहे. ओके, सो आता पूर्वी जे वेडेवाकडे दात एवढे नव्हते, आता ते जास्त होत आहेत. किंवा जे TMJ प्रॉब्लेम्स म्हणा, मॅलऑक्लुजन्स म्हणा, हे जे सगळे इश्यूज जे आधी नव्हते ते आता वाढले आहेत. बिकॉज ऑफ द फूड दॅट वी आर इटिंग, द टाईप ऑफ फूड, रॉ फूड कमी झालं आहे, प्रोसेस्ड फूड वाढलेलं आहे. तर त्याच्यामुळे हा जो सगळा अँगल हे सगळं नॅरो झालेलं आहे, आणि त्याच्यामुळे ह्या तोंडातल्या सगळ्या स्पेसेस सगळ्या कमी झालेल्या आहेत. आणि त्याच्यामुळे ह्या सगळ्या म्हणजे TMJ प्रॉब्लेम्स आणि जे बाईट प्रॉब्लेम्स जे असतात, मॅलऑक्लुजन्स, त्याच्यामुळे TMJ वरती लोड येतो, आणि त्याच्यामुळे त्याचं म्हणजे इट इज गेटिंग इंटरलिंक्ड मोर अँड मोर. आणि ते कसं असतं, जर यंगर एजमध्ये तुम्ही ते पकडलं की जास्त तिथल्या तिथे जर तुम्ही तो प्रॉब्लेम सॉल्व्ह झाला तर पुढे जाऊन ॲथलीटला TMJ इश्यूज होण्याची चान्सेस ड्रास्टिकली, जर तुमचं मॅलऑक्लुजन लहान असताना जर करेक्ट झालं वेळेवर, तर पुढे जाऊन म्हणजे TMJ डिसऑर्डर्सची इतर कारणं होऊ शकतात नंतर. पण ह्या प्रॉब्लेममुळे, डेंटल किंवा ऑक्लुझल बाईट प्रॉब्लेममुळे TMJचे प्रॉब्लेम्स आम्ही त्या 10 to 14 या एज ग्रुपमध्ये तिथेच ट्रीट करून डेफिनेटली त्याला कर्व करू शकतो, सो तर पुढे हे प्रॉब्लेम नाही होणार.
आणि आय थिंक द मेन अजून एक मोठं कारण म्हणजे पोस्चर. टेक्स्ट सिंड्रोम, that is also causing biggest reason I think.
आणि आय थिंक स्ट्रेस मॅनेजमेंट सुद्धा आय थिंक कुठे ना कुठेतरी, बिकॉज हे सगळं जे आपलं आहे पेन,
सायकोसोमॅटिक गोष्टी, TMJच्या मेजरली गोष्टी सायकोसोमॅटिक, स्पोर्ट्स आणि इंजुरी रिलेटेड असू शकेल, पण मेजरली सगळं सायकोसोमॅटिक आहे.
Yes. So my next question is to that have you seen any incidences of bruxing in athletes, and in which sports is it commonly seen? Is there any typical kind?
I think as ma'am said that most of the grinding that we're doing is psychosomatic. It's a lot of stress. So there's a lot of relation between psychologists working on it, and also at the same time dentist. But what can happen if an athlete can visit a dentist, just for a regular assessment? We can also get to know their psychological issues happening. Whether do they have anxiety, are they getting anxious? How to stay calm. Like somebody say breathe. Now, if you are playing the Olympic final, you are about to die. You don't know how to breathe. So you cannot breathe. So if you see Lakshya Sen, what happened? In the semi-finals and finals, that is what happened. You cannot breathe. So of course, coming back to a lot of grinding issues that we see is happening at the level when they are closer to competition. Of course, there's more research that has to be needed for this, but things like mouth guard should be used while sleeping. Of course, you can give more solutions, but we need practical usage. Every time we take an athlete to somebody, they're like, we'll teach you how to breathe. I said, I do not want you to teach my athlete how to breathe. Just give me a solution as to what can be done for this. So this by itself takes a year, probably a couple of years to work on it.
You have to condition them. Last moment la kahi hot nahi.
And this has to happen at the very grassroots level. Because an Olympic athlete, right? If I tell you, stop eating varan bhat from your food, and when you are at this age, when you are after 30, you cannot do that. Now telling somebody, to stop X, Y, Z things, and they are already at this level, it's very difficult. So I think conditioning at the very grassroots level is very, very important.
So as you said, pre-medical assessment
is very important.
The mental part has to be there.
आणि सगळ्यांनी एका प्लेन वर येऊन त्या व्यक्ती बरोबर राहणं फार महत्त्वाचं आहे.
वेगवेगळी लोक वेगवेगळे प्रेशर,
प्रेशर
वेगळं, पेरेंट्सचं प्रेशर वेगळं, पीअर प्रेशर परत वेगळं.
And I think in all of this, the coach has to be, counseled. Because I'll tell you, there are at times when I have had a visual, graphical representation of how much load an athlete is doing. What response I've got from the coach? तुझं लक्ष नाही कामावर, हे काय आहे? So coaches are the one who have to be educated at the ground level. They should know what we are actually doing. How can we make a change in an athlete's life?
त्यांचा एक शब्द can
make or break.
Yes.
So, and we are dealing with small kids' career.
Sensitive individuals are
here. To give an example. So when we were in Asia Cup, India, it was just post-lockdown. And we were playing in that bio bubble. Unfortunately, Thailand team's head coach, she got COVID positive. And she had to be quarantined. And imagine all the players, head coach's presence asto. It matters a lot to all the athletes. And it was not there. She was not there. And the team just collapsed. The team just collapsed. So this is what a coach, so it can just make or break.
Of course. एक शब्द can move your and
And I think what happens, this is a problem with, I think, all of us. The minute we ask people to do certain tests, they are kharcha nahi karna.
No, that's the.
I don't want to get into this at all. So there have been a lot of athletes that I have worked with who've done their ECG is normal. When they went to a physician, the physician said the ECG is completely normal. But then we went to a cardiologist somewhere out. We've detected Brugada syndrome, in their heart. We've got no idea what went wrong. So just ignorance, at a very important level is very dangerous. That just because somebody at a lower level didn't know how to read an ECG, it got delayed probably for the 7 more years, and then we realized, and then we got to know that either we have to put a pacemaker or we have to carry a defibrillator every time when we travel. So things can go wrong at such a level.
Career is at stake.
Is at stake. So that is why having a specialist on board at a very bottom level is very, very important. At a screening level.
So we'll need a lot of sponsors for our grassroots level players, because हे सगळं affordability आणि ते सगळं खूप गोष्टी आहेत. Money is a big thing and can move mountains sometimes. Yes, definitely. I think things need to be planned better before you actually, म्हणजे लॉंग टर्म तुम्ही जे सगळं टीम इंडियाचं आणि मॅडमचं जे मिशन वगैरे सगळं बोलताय, म्हणजे आता ह्याच्या पुढचं आय एम नॉट सो मच इन टू ऑल दिस, बट सिन्स नाव न्यू थॉट प्रोसेसेस आर स्टार्टिंग, वी नीड टू रिअली स्टार्ट यंग अँड एम अँड मेक अ ट्रेनिंग sheet maybe किंवा training calendar for years to come for a particular person and involving everything आणि मग remedial measures, identification, diagnosis केल्यानंतर मग बऱ्याच गोष्टी खरं तर maybe you could start with all this when you are identifying and हो खरंच yes and you could involve because now we have the who's who in all the fields here. Really, it could be a very good total program, holistic approach, and we have a pranic healer as well with us. So pranic healing, because we've not touched that anywhere here, but that could definitely play a big role.
No, I think some of the stuff that we Indians do are made fun of, in the Western countries. But things like pranic healing, we have to be open and we need to know what is happening.
Definitely.
And then I think recently we've been doing a lot of Shambhavi mudras just to keep an athlete, and it's working amazingly for an athlete. We are saving so much money by not going to a psychologist because we're just doing this basic stuff. So
definitely,
that's important.
You need to think differently.
Yes, I'm sorry we are running short of time. So my next question is.
Yes.
Yeah, proteins. So how you manage their protein needs for various sports?
So we calculate according
through the food or through
it is a combination based on the intensity. For a child athlete, maybe we don't recommend any supplement, but after a certain point of time, if they have 3 training sessions in a day, it is very difficult to meet the protein requirement only through the food. And we also have a lot of vegetarian athletes who are not able to get the
vegan
athletes. Yes, vegan is another big challenge that we have. So then we do recommend supplements, but we have to take into account the safety and the composition of the supplement. So that we have to be very stringent about. We read the labels, we check how to source the supplement is also important, and there are also third-party certifications for the supplements that are available in the market. So without that, we generally don't, and we should, as a nutritionist, it's a very risky affair, and we have to be very sure about recommending a supplement. Without that, we just rapidly don't do anything, and we ourselves are very careful about this when we recommend, because we see that 50% of the time the coaches, other support, also they themselves recommend supplements without understanding their, like you are a pathologist, so you know how you do the blood reports and then analyze, and based on their dietary recall whether we should be giving the supplement. So all that proper assessment is done, and then only we recommend.
And just to add to that, ma'am, biological value of food in India is very different compared to the quality of food that you get abroad. Right? So especially in weight class categories, probably somebody who's a boxer or a wrestler who's playing a 60 kilo or a 70 kilo, it matters quite a lot because we've seen what happened. So that was the problem. The nutritionist here didn't have any idea about the biological value of food in France. So a chicken that you eat here is very different from the chicken that you eat here. The egg here might have 10 calories, there might have 20 calories. We don't know that. So that is also very important. So it's important for a nutritionist to consider that. And there was, just to answer the previous question also, at how much carbohydrate to give also depends on the event that we are playing.
Exactly.
Sometimes when we measure
it depends upon the event, the duration of match. For example, a boxing or wrestling match will be only for a few minutes, like 12 minutes, 10 minutes. But the other events like tennis, longer.
From the point of view, I want to ask Dr. Sneha that treatment of bruxism in athletes, what the treatments can be given?
Most important, because as we discussed, the psychological aspect and the conditioning and treating of it is going to take a very long time. So till that time that happens, immediately we have to start off with a night guard. So night guard is again similar to a mouth guard. We have to take the athlete's impression and we send it to the lab and they make it customized for that particular patient. So what happens is, because of the night guard, when the patient, especially what happens, night grinding is seen a lot in many cases. So and then obviously because the patient is night, they don't have control over it. At least during the day we can tell them something, but what about night? And we have to ask our patients, so you can also ask them this question if you want to refer for night guard, that when you wake up, is this entire region paining? That is the simple message. Again, everything is getting stressed out. So if they wake up in the morning, if they are not fresh, if this entire region, if it is paining, they are not this, then that is the best way to understand that they are doing night grinding, and we have to immediately give them a night guard, because that is the only way. See, because what happens, we see patients later on at the age of 40 to 50, अब सब कुछ हो गया है, and now you have to spend a lot of money on dental rehabilitation, because full mouth rehabilitation cases we have to do later on, because these things were not to some extent addressed at that time in the athlete's life, or even in some other patients who are having, you know, acidity issues like GERD is there, or eating disorder is there. So all these in the end are going to erode the teeth. So night guards for that, and plus counseling simultaneously at the same time.
I think one thing we missed, sorry, because all of you here will be prescribing medications to athletes.
Doping issue.
Doping is a very, very big issue, and there have been guidelines as to when the medications have to be flushed out of the system. So, and then if you are using it, it's important that there is a form which is called TUE, therapeutic exemption use. So we fill that form, so that whenever we travel with an athlete, they've got an app. So we have to check into that WADA app every time that we are in this location. Failing to do it twice, failing to do it twice means I am not playing Olympics, I am banned. Yeah, and these guys anywhere in the part of the world, you know, can come, you know, and it will be a random raid sort of a situation where they will be taking my urine samples, and, you know, taking saliva samples and stuff like that. And there have been instances where, you know, dentists have recommended dexamethasone, you know, which right. So, you know, of course, the use of glucocorticoids, you know, it's very, very, very important that how much are we prescribing. Because if that happens, you know, if you might have read recently about this player called Sinner, you know, so the physiotherapist just applied a cream. You know, they rubbed a cream, and while they were being tested, they tested of this substance called as clostebol, which is banned. So he was banned now, he's banned now for the next 3 months. Just by applying the cream. Yeah. So he might not play the French Open. Right. So, you know, stuff like...
So again, you know what happens, again this is underlying the thing that, you know, preventive dental treatment, why it is necessary, because what he is saying is true for the dentist also, because the two biggest problems that the patient encounter are acute abscess, especially if they are having a third molar when the prime athletes were in their 18 to 30 age group. So if they are having a third molar pain, or if they are having pain, or, you know, the decay is deep in any tooth, they have to get it treated before any event. Because what happens when there is acute pain and abscess, and when they come running to us, then we have to prescribe 2 medications which are banned. First of all is the corticosteroid to reduce that acute swelling, because otherwise it is not, tomorrow if you have an event, it is not going to go immediately, only if you give that. And another thing is, recently 2024, the worst thing that they did was they banned tramadol. So in case of severe dental pain, the go-to drug is tramadol.
And in such cases, you can also do retrospective healing, which is like at that point, if you really require.
Definitely. So yes, that is in the end, retrospective TO is what we have to do. But even see, 10 cases, 10 patients we treat. in advance. Maybe only one patient in future might require retrospective POV. But if the rest of the 9, if we don't need any, they don't land up in any such kind of problem in the first place, that will be better. So if they, that is why we do the oral screening. We advise to do the oral screening 3 months later if you have your event. 3 months before only, because any dental treatment needs minimum a month. And especially treatments like these which are having teeth are having infections or third molars. Okay, because initially we'll have to give a course of antibiotics and painkillers and then reduce the swelling and then do the treatment, whether it is third molar or whether it is a root canal. So if that tooth is treated well in time, this problem of abscess won't come up and they won't need a corticosteroid and a painkiller which is banned.
And they can travel from whether at sea level or in the air anywhere.
There is also an app,